A warm good evening to one and all. I'm Shilla Thomas, first year MBBS student of Government Medical College, Calicut. With immense pleasure, I welcome you all to Mediolympiad Round 3, conducted by Union 2022 in association with DocTutorials. Medmeet 2.0 is an international UG conference held at Government Medical College, Calicut. We have gathered here for one of the most prestigious events of Medmeet, Mediolympiad Round 3. And now over to Rahul, sir.
So, hello everyone. So, welcome to all for the final of the Medmeet National Quiz, the Mediolympiad. So, this quiz, this is an initiative by the College Union of Government Medical College, Calicut, and is being done in association with DocTutorials. So, a very prestigious event, and this quiz, the Mediolympiad, was in 3 rounds, and here we are into the third and the final round. The first round and the second round were MCQ rounds. After the first round, we had 30 participants who were selected for the second round, and in the second round, we had lengthy clinical scenarios and students had to answer that. And based on that, the top 6 of the country have been selected, and here we are into the finals. So, first of all, I'll just, are you able to see my screen, everyone?
Yes, sir.
All right.
Yes, sir.
So, so these are the 6 finalists. So, first of all, we'll introduce these finalists because, they are real champions having come to this finals. So we can start off with Dr. Soumitra. Please introduce yourself. Dr. Soumitra, you are muted. Dr. Soumitra? Okay, Dr. Radha?
Yes, sir. Good evening, sir. I'm Radha Agarwal. I'm a student of RIMS Rajsi. I'm from 2017 batch and I'm an intern at present.
Okay, good. Dr. Vicky?
Hello, good evening, everyone, all the respected judges and all my dear fellow participants. I am Dr. Vicky Datta from Guwahati Medical College, final year MBBS student, Assam. Thank you, everyone.
Dr. Akash?
Good evening, sir and everyone. I am Akash Sethi. I am an intern at Government Medical College, Gujarat, and I am very happy to be here.
Dr. Devang?
Good evening, everyone. I am Devang Agarwal. I am a third pro student from 2019 batch, and I am a student of AIMS Rishikesh.
And Dr. Aryan?
Hello, good evening, everyone. I am Aryan Singla, third year student from AIMS Rishikesh.
Okay, and Dr. Soumitra? No, Soumitra, you're muted. You're muted. So I think for some reason Soumitra is muted. Okay, so Soumitra, just check it up. Meanwhile, I'll go to the introduction of the quiz masters. So today's team of quiz masters, we have in fact a team of quiz masters, and I'm Dr. Rahul Rajiv. I'm the medicine faculty in DocTutorials, and I'll be one of the quiz masters. And let me introduce to you the other quiz masters. Welcome to Raja Mahendran, sir. Sir, good evening.
Good evening, sir.
Good evening, sir. Good evening. So, sir requires no introduction, is one of the premier surgery faculties of the country.
Thank you for inviting me, Dr. Rahul, sir. Thank you so much for this opportunity. Happy to see all the topmost brains in front of me. Happy to see all the toppers also.
And Rajitavan sir.
Hey, good evening, everyone, and thank you, Dr. Rahul. And my heartiest congratulations to the Calicut Medical College Student Union for such a beautiful academic extravaganza they've created in all these days. And I've been really, enjoying whatever I could really see it on the social media. So amazing efforts on their part. I'm really excited to be part of this event, which is the final of Mediolympiad.
And Sandeep sir.
Hi everyone. Good evening to everyone, all my fellow colleagues and all the students who are attending this quiz. It's always a pleasure to be part of a academic exercise like this. And irrespective of the results, I think all the students who have been able to reach up to this level, you all belong to a very elite category. And those who have not been able to reach, they should also attend to this session, because we have created some very good questions, and these questions are going to be very clinically oriented, and they are going to be helpful in your all competitive exams, your college exams, and you are definitely going to benefit out of it. So being a quiz master myself, I'm actually looking forward to being a part of this extravaganza.
Yes, and one man again the country is wanting to listen to is Dr. Anirban, who's the man of the moment, rank 1 in INICT November. And not just that, that is not just his credentials, he is also a very famous quizzer. Probably during his MBBS days has won innumerable number of quiz events, including the one that I conducted. So Anirban, hearty welcome.
Yes, sir. So it's a privilege for me to be a quizmaster among the faculties who have taught me like 1 month before. So it's a great honor for me to conduct and host some rounds here in this final quiz. And also I had conducted the round 2 and the level of clinical vignettes which I had set, and the participants who have come, they have come a long way after that hurdle. So I welcome all the finalists, and it's a privilege for me, and I'd be looking forward to conduct the rounds the best I can, and all the best to everyone.
And I think as all the quiz masters rightly said, all these 6 participants are winners. There is no winner and loser. It's just about answering the questions on this particular day, because the round 2 was also a very tough one. All the questions of round 2 was put by Dr. Anirban, and it was very clinically oriented, and these students who have qualified for the finals have really prepared well. So I think, it's time we move forward. Soumitra, is your issue sorted?
Yes, am I audible now?
You're very much audible. Okay,
Yeah.
so
Yeah,
you're
this is
waiting to hear
Soumitra.
answers also from all of you guys. All right, so all excited for this finals. So well, I'm sure that you must be excited more to know about the prizes as well. So the first prize winner will get a cash prize of 25,000 rupees. The second prize is 15,000 rupees, and third prize is 10,000 rupees. But in addition to that, all the 6 finalists will be getting access to the NEET PG Power Pack of DocTutorials, and you all will be there with us in the special WhatsApp group that we have, the Elite Wizards group, where all the faculties will be mentoring you guys as well. Okay, so with that, I think we'll move forward. Meanwhile, I'll again extend my hearty thanks to the College Union, and let me just introduce to you the scorers of the event as well. So scorers, can you please introduce yourself? You're there.
Hello, sir.
Yeah. Please introduce.
I'm Muhammad Nadir.
Yeah.
First year student, Government Medical College, Calicut.
Yeah. Good evening.
Good evening, sir.
Anyone else? Okay. And I think Amol was helping with the buzzers as well. Amol is also there. Yeah.
Yes, hello, sir. I'm helping with the timings and the buzzers.
Thanks.
I'm also first year, 66 batch, Calicut Medical College.
All right, great, Aman. And see, all together, now we'll start off without wasting any time, and let's get started. So all together, 11 rounds, okay? And talking about the rounds, see, in general, there are two rules for this quiz. The first rule is Quizmaster's decision is final. And rule number 2 is, in any case of controversy, please refer to rule number 1. So it's all about Quizmaster deciding the scores. There should not be any controversy. However, any specific rule regarding a specific round, the Quizmaster will be telling. And coming to the scorers, so scorer, can you actually just give an arbitrary number to 1 to 6 to these candidates, so that we just say candidate number 1 and so candidate gets the question. So are you ready with the arbitrary numbers? So can you just tell the arbitrary numbers? So just give a number to any of the candidates and just you can announce. Scorers?
Yes, sir.
Yeah.
Okay. We have assigned number 1 for Saumitra.
Okay.
And number 2, Akash. Number 3, Aryan. Number 4, Biki. Number 5, Devang. And number 6, Radha.
Okay. All right. And so during the entire round of the quizzes, all the participants are supposed to keep your video on. During the entire rounds of the quizzes, your video should be on. This is to ensure that there is a complete transparency. And I'm sure that you need not look into any device, because obviously you are so bright, which is why you are here. And I'll start off with the first round. The first round, there is no passing. Each candidate gets 1 question, and correct answer which will fetch you 10 marks. There is no negative. And after I finish the question, I'll give you 30 seconds to answer. Once I'm done with the question, I'll tell you, you can answer now, maximum 30 seconds. Okay, there is no passing in this round. So the first round is a very simple round. It's very, very simple. It's almost like a warm-up round. And this is just to test your basic clinical skills. Okay, so it's not any high funda questions, very simple basic skills, so that you can get off the mark and feel relaxed. Simple round to start off with. So candidate number 1, are you ready? Yes?
Yes,
Say yes. Yes. So here is your first question. The question is this: what is the root value of the reflex that is being shown or demonstrated? Yes, your time starts now. Please keep your video on. Please keep your video on.
So the root value is L5S1.
Saumitra, your video is not on.
Sir, I have joined with 2 devices. Audio was issue. So my laptop video is on. You can see me. And my mobile video is off.
What is the answer? What is the answer?
L5S1.
Well, it is the wrong answer. So this is the ankle jerk, and the root value of ankle jerk is S1, S2. The root value of the plantar is L5, S1. This is ankle jerk that is being shown. This is S1, S2. Okay. All right. Moving to candidate number 2. So who's candidate number 2? Ready?
Akash.
Ready. Akash?
Yes, sir.
Yeah. Keep your video on. Here is your question. What is being palpated by the examiner? Have a good close look and then tell me, look at the position of the hand, everything, and just tell me what is being palpated by the examiner.
Sir, is the examiner palpating for the water hammer pulse?
No, this is not a palpation of the water hammer pulse, because water hammer pulse, if you want to feel the pulse, that is actually pulsated with the base of the fingers, and then you actually lift up. And this is not the way, you lift for a water hammer pulse. So the correct answer is, this is the way of palpation of which important lymph node? This is the palpation of the epitrochlear lymph node. So in the epitrochlear lymph node palpation, the patient's right wrist is supported with your left hand, and you hold the partially flexed elbow with your right hand, and then you use the thumb to feel the epitrochlear node. So if you're palpating the left epitrochlear node, you will use the left thumb. So this is a left epitrochlear lymph node palpation. Okay, candidate 3, are you ready? Yes?
Yes, sir. Yes,
Here
sir.
is your question. What is the likely murmur being auscultated? Have a good close look at the question and let me know what is the likely murmur that is being auscultated. 30 seconds.
Sir, mitral stenosis murmur? Any mitral valve murmur?
Why?
Sir, it is the location on the cardiac apex in the fifth intercostal space.
Just that, is that why you said it is MS murmur?
Yes, sir.
No other pointers?
Sir, might be the lateral decubitus position also.
Exactly. So good. So you get 10 marks, and not just that, you can see that the examiner is auscultating with the bell of the stethoscope. So you can see this murmur is being auscultated in the left lateral position with the bell of the stethoscope. So this is a MDM murmur of mitral stenosis, best heard at the apex with the bell of the stethoscope with the patient in the left lateral recumbent position. Okay, so you get 10 points for that. Okay, all right. Candidate number 4, I suppose. Next is 4.
Yes, sir. Vicky, yes, ready.
Yes, Vicky, here is your question. Identify the sign that is being demonstrated, and you can see the positive response there. And that response is being shown. That is a positive response, but what is the sign being demonstrated?
So is it Babinski equivalent?
You have to name the sign.
Yeah.
Everyone keep your video on.
So Oppenheim sign.
Absolutely right. Fantastic answer. This is the Oppenheim sign, where the examiner is stroking the anteromedial surface of the tibia from the infrapatellar region to the downwards. And you can see that there is an extensor response. Yes, this is a Babinski equivalent, and what is being demonstrated is the Oppenheim sign. Fantastic. You get 10 full marks. Okay. Next is candidate number 5, I suppose.
Good evening, sir. Yes, sir.
Yeah. So get ready. Here is your question. So identify the bedside test which is being performed in a patient with recurrent oral and genital ulcers.
Sir, is this test pathology test done for Behçet's disease?
Absolutely right. And what is a positive reaction for the pathology test?
So this erythema margin, like more than 5 millimeters of erythema is generally taken.
It's not erythema alone, no.
Erythema plus induced. I'm not exactly very sure. So like there should be erythema.
Okay. But your knowledge on that is partial, but still, since you answered the question rightly, you will get full 10 points.
Yes.
So the correct answer is, you actually give a sterile needle prick to the forearm using a hypodermic needle, and a positive reaction is an erythematous nodule or a pustule that is more than 2 millimeters in diameter at 24 to 48 hours. So that is a positive pathology test. Okay. All right. So the last candidate for this round, are you ready? Yes?
Yes, sir.
Yes. So here's your question. So the examiner has drawn a circle. The patient is asked to mark the numbers of the clock. Okay. And then the time as 6 o'clock. This is what the patient has drawn. Tell me, what is the finding?
Sir, it suggests hemispatial neglect in lesions of right parietal cortex.
Yeah, absolutely right. So it is a hemi-neglect. So you said right parietal cortex. Radha, if I may ask you one thing, is there a right hemi-neglect or only there can be a left hemi-neglect?
Sir, only left side is there.
Fantastic. Good concepts. There can only be a left hemi-neglect. Okay, right. Okay. So that ends this round, and that is the end of round 1. Okay. And we'll see the score after round 2. And for round 2, the round will be conducted by Dr. Rajidavan sir. So someone who is a powerhouse of positive energy that we say. Rajiv sir?
Yes, sir.
Yeah. So over to you, sir, for conducting the second round of the Mediolympiad.
Yes, sir. Yes, sir. And sir, wonderful. I really truly enjoyed this round actually, which you conducted, and thoroughly enjoyable for me. And I'm sure people who have joined us on YouTube, and they would be certainly learning a lot of things coming, which are useful for the upcoming exam in, curriculum MBBS or otherwise later on the PG exams as well. And sir, we maybe know the score as of now, sir. Like, what is the
scorers? Just please announce the scores.
So participant number 1, 0 points. Participant number 2, 0 points. Participant number 3, 10 points. Participant number 4, 10 points. Participant number 5, 10 points. Participant number 6, 10 points.
Wonderful. So allow me to share the screen, sir.
Sure, sure.
So is my screen visible to everyone?
Yes, sir.
Yes, sir. Please make it full
Okay.
screen. PowerPoint presentation.
Okay. Okay, fine. Guys, welcome to this ENT round of this Mediolympiad final quiz. And we have one question coming out of ENT for everyone. Every question would be carrying 10 marks. There'll be no pass to anyone. And as Dr. Rahul said, we'll have to keep the screen on. And if you have the partial answer, the marks will be reduced appropriately. But if the answer is actually describing what is being asked, then of course full marks. But there's no negative marking for this round as well. So Rahul, we can
please make it full
yes,
screen, sir. Full screen, sir. PowerPoint mode.
So it's PowerPoint mode right now at my end, sir.
You have to click on the. It's not PowerPoint mode, sir. You have to click on that.
You make it a slideshow mode, sir. Slideshow. You run the slideshow.
Slideshow mode. Slideshow.
Because the second question we don't have this.
1 second, sir. 1 second. Let me. One second. Huh?
After you share the screen, sir, then you have to press on slideshow.
Is it okay?
Perfect. Perfect.
No. Still it is same?
Perfect, sir. Perfect. Correct now. Perfect.
Okay, fine. So let's start the ENT round now. Participant number 1, can you say out your name, please?
Yes, sir. Soumitra Gill. Ready.
Okay, Soumitra. Okay. Can we have your video on over here?
Sir, my mobile video is on.
Okay. You told me, yes, your audio issues. Okay, fine. So question for you, Soumitra. Name the clinical entity whose clinical pictures are shown in the images. Which patient would have all these 3? What's the name of the clinical entity being shown in the images?
Is it Melkerson-Rosenthal syndrome?
That's perfectly correct answer. It's Melkerson-Rosenthal syndrome with the triad of recurrent facial paralysis and fissuring of tongue and the swelling of lips. Wonderful. And you get the 10 marks for this answer. Wonderful. Candidate number 2, can you say out your name, please?
Hi, sir. This is Akash.
Akash. Okay, Akash. Okay, Akash, question for you. Can you name the device which will be used for hearing rehabilitation for the patient whose MRI brain is shown in the image right now?
Sir, we'll be using brainstem implants.
Okay, what's the name? What's the diagnosis in your mind right now?
Sir, it's bilateral schwannoma, most likely going to be NF2 associated.
Okay, and the name of device you are saying is, once again?
Brainstem implant.
Yeah, wonderful. That's perfectly all right. So you are absolutely correct. It's a possible case of neurofibroma type 2 with bilateral vestibular schwannomas, 8 nerve tumors, and the device required for the hearing would be definitely not cochlear implant. It will be auditory brainstem implant. And for the listeners on YouTube, may I tell you that this implant will be placed in lateral recess of 4th ventricle, a very famous question of the NEET PG examination as well. So wonderful. You get the full 10 marks, Akash. Candidate number 3, can you say out your name, please?
Good evening, sir. Myself, Aryan Singla.
Aryan, wonderful, Aryan. Aryan, it's your turn now.
Yes.
Can you
Okay,
think
sir.
about what kind of device of hearing rehabilitation would be, recommending for the patient whose clinical picture is shown in the image right now?
So maybe bone anchored hearing aids, Baha.
Okay. And what is the diagnosis in your mind right now, looking at the clinical picture? What you are thinking? What it is?
So it's anosia, pinna is absent.
Yeah, wonderful. That's amazing. So you are right. It's anosia. The pinna is absent over there. So there is no chance of putting a conventional hearing aid. So you'll have to go for the bone anchored hearing aid. And my dear friends, bone anchored hearing aid is a very, very important question for the upcoming NEET PG and FMG examination also. And the bone anchored hearing aid works through bone conduction. And the other indication of this is external auditory canal atresia, and of course, the chronic discharging ear. Now, you get the full 10 marks, Saran. As of now, every candidate has scored beautifully in all three questions, and everybody gets 10 marks for their respective questions. Candidate number 4, please say out your name.
Hello, sir. I am Vicky Datta.
Hi, Vicky. Vicky, you are from Guwahati Medical College? Where?
Yes, sir.
Yeah, wonderful. Okay. So, question for you, Vicky. You are seeing the temporal bone specimen in front of you, and there is like a orange arrow over there. It's showing a landmark over there. You have to tell what structure this orange arrow is pointing at in this temporal bone specimen.
So it's a bulge of the semicircular canals.
Can you tell me which canal would you be thinking of?
Sir, posterior semicircular canal, sir. Lateral, sir. Little, sir.
Final answer from your side. Now you say out your final answer.
Okay. Sir, lateral semicircular canal.
Once again, can you say louder?
Sir, lateral semicircular canals.
That's perfectly correct answer. It is lateral semicircular canal bulge, and it was a really challenging question, Vicky. And this is a very beautiful landmark which we use as ENT surgeons to look for the second genu of the facial nerve. Again, a NEET PG question. And may I remind all the aspirants of the NEET PG listening us on YouTube that the surgical landmark for the first genu will be processus cochleariformis. And the surgical landmark for second genu is in front of you right now, which Vicky Datta has rightly pointed out. It's lateral semicircular canal bulge. And Vicky, you are getting 10 marks for this beautiful answer of this question. Wonderful. You're already thinking like a surgeon. So question number 5, can we have candidate number 5 over here?
Good evening, sir. This is Devang Agarwal.
Hi, Devang. You are from AIMS.
Rishikesh, sir.
AIMS Rishikesh. Okay, wonderful.
Yes, sir.
So question for you, Devang.
Yes, sir.
You have to tell me what structure would be tested with the investigation being shown in the image right now.
So we are testing the inferior vestibular nerve. We are testing the SCM reflex from the inferior.
So you are actually. Can you tell me the name of investigation? Though it's not required for the final answer, but what is the name of this investigation in front of you?
Yes, sir. Like this is VEP, sir.
Yeah. Can you tell me the full name? VEM full name?
VEM's so vestibular evoked myogenic potentials.
And can you tell me the final answer for this question? Which structure is being tested right now?
So we're testing the cervical VEM, CVM.
No.
The
Sorry?
SCM. So we are testing the inferior vestibular nerve, and we are testing the sternocleidomastoid reflex.
Yeah, absolutely. That's correct answer. So this test is called VAMP, vestibular evoked myogenic potential. And my dear friends, this is a very important question again for INICT. The basic testing principle is we stimulate saccule with a loud sound, and we test the inferior vestibular division of the 8th nerve, and it's called vestibulocholic reflex actually. Okay, so correct answer, Devang over there. So 10 marks to you also.
Thanks.
Wonderful. Either the question I've asked are simple or the candidates here are brilliant, and I'm sure because right now we are having on the screen the brilliant medical minds of this country, which have come through a rigorous process screening. So I'm sure that all these questions, which would be very challenging question for everyone, you are actually able to tackle them. So that proves that the screening selection process has been really, really rigorous over there. That's amazing. So can we have candidate number 6 now? Candidate number 6, can you say your name, please? Candidate number 6. Are you mute or?
Scorer, who is candidate number 6?
Number 6.
Radha, sir.
Radha,
Sorry?
Dr. Radha, correct?
Yes, Dr. Radha is the 6th candidate.
Okay.
Yeah. Are you there?
I think she just disconnected from the meeting, probably joining again.
Yeah, sure. Yeah, definitely. We'll wait for her to come. If somebody has her WhatsApp number, you can, convey it to her. We're waiting for her.
She's having a network issue, sir.
Okay. Let's. Let me know when she's there on the screen. In the meantime, I must say all the 5 candidates who have answered these questions are really, they were a little challenging question as far as the ENT circle is concerned. And all of them, let me tell you, all of them are possible, questions in the upcoming exams as well, in the NEET PG, INICT as well. So that's the beauty of this whole quiz process, that all the questions being discussed over here are the clinical questions, conceptual questions, and the possible questions in the upcoming exams as well.
Yeah, Dr. Radha has joined.
Dr. Radha, are you there?
Yes, sir.
Can we have your video on?
Sir, video is on.
Yeah. Okay. Radha, you're from which college?
Sir, RIMS Ranchi.
Wonderful. So it's your question, Radha. Okay. Question number 6 is for you. You have to tell me, there's a landmark of the middle ear being pointed with a yellow arrow over there. You have to name this structure.
Sir, it got paused.
Everybody, can you see that question?
Radha,
Yes,
maybe
sir.
Sir, we can
you're
see it.
having a network problem. You can keep maybe your video off, since you're having a network issue.
Radha, are you able to see it on the screen right now?
Yes, sir. Sir, I'm able to
Okay.
see the screen, but voice is breaking.
No problem. You just tell me read the statement and tell me the answer. What structure is being pointed with the yellow arrow over there?
Sir, is it processus cochleariformis?
Okay. Your final answer? Can you say it again?
Sir, is it processus cochleariformis?
Radha, unfortunately, it's a wrong answer. This is actually pyramid. You can see pyramid is a projection on the posterior wall of the middle ear. And if you see the orange, this yellow arrow, from that pyramid, one muscle is coming out, the tendon of the stapedius muscle, and that is attaching to the stapes. So unfortunately, the answer of your this question is incorrect. It's not processus cochleariformis, it's pyramid. And rather, you will not be getting any mark for this particular question. And with this, we have come to the end of the ENT round. And thank you very much. And my best wishes to every participant for the upcoming rounds as well. I stop sharing the screen, sir. Yeah. Over to Dr. Rahul Rajiv.
Yeah. So an exciting second round. And sir, I agree with what you said. It's not that the questions are simple. These guys are super intelligent. So that's why, they're answering so beautifully well. And I think, those who could not answer well in the first 2 rounds, don't worry. A lot of exciting rounds are coming up. So definitely you can catch up. And scorers, can you please let know? I think Nadir, Dr. Nadir, can you please let us know the scores?
Yes, sir. Participant number 1, 10 points. Participant number 2, 10 points. Participant number 3, 10 points. Participant number 4, 10 points. Participant number 5, 10 points. Participant number 6, 0 points. These are the scores in the round 2.
Oh, I want the combined scores.
Combined round here. Yeah. Combined score will be better. Yeah.
Please go for the combined scores. Okay.
Combined scores will be participant number 1, 10. Participant number 2, 10 points. Participant number 3, 20 points. Participant number 4, 20 points. Participant number 5, 20 points. Participant number 6, 10 points.
All right. So who's leading now? Who's at top position now? Nadir?
3, 4, 5, all are with 20 points.
And participants also please keep a track on your scores so that everything is very transparent. All right. So the next round is next few rounds is going to be hosted by one of the doyens of surgery, Dr. Raja Mahendran sir, who is a surgeon, who's an author, and who's a wonderful teacher. Sir, over to you for the next round, sir.
Thank you, sir. Thank you so much. So I'm sharing my screen. Yes. So hope you are seeing my screen. Yeah, you are seeing my screen, sir?
Yes, sir. Clear.
First question to Dr. Soumitra.
Yes.
All these rounds will be in such a way, I will be first giving the question. The answer for this question is not the quiz. There will be another question coming, that will be the question. Okay. So what you have, because only if you understand this concept, I can go to the real quiz question. Okay. So let us start the question. 35 years male, presents with severe back pain and gives history of on and off mood swings for which he is treated by psychiatrist. He complains of treatment taken for renal stones and some bony lesions. He is having calcific pancreatitis on CT abdomen. On examination, he is having a 2 centimeter nodule in the thyroid region. So what will be the next investigation and what will be the gold standard investigation to know about the lesion? Yes, please tell me, Soumitra, what is this case? First of all, what is this case? What do you think this case?
So means looks like parathyroid adenoma causing hypercalcemia.
Very good, very good. That's correct.
And next investigation would be a USG.
Okay.
And the gold standard will be FNAC and biopsy.
Gold standard investigation to know about lesion you feel as FNAC and biopsy. Okay, let us. Anyhow, you are near the concept. Let me now go to the quiz question. This is the quiz question. So actually the investigation to know the lesion is not FNAC. We have to locate the lesion is by means of system EB scan. Okay, system EB scan has been done. So the question is, what is the other lesion which can cause false positive in system EB scan? That is a quiz question. This all questions are taken from Bailey and Rao, not from any other book. So what is the other lesion which will be seen as confusing as parathyroid adenoma in system EB scan? That's a question. This is a direct line from Bailey and Rao. If you go and see, that line is there. Yes. Yes, just 15 seconds only. We cannot waste more time because I have 3 rounds to complete. Amitra, we'll go on.
Yes? No, sir, I cannot.
Yeah, please. If you don't know, if you cannot guess here. If you know the answer, you tell. Otherwise, you tell pass. Okay. So we will stop this. The answer for this is Hurthle cell adenoma. Okay, this is Hurthle cell adenoma. Because of the oxyphil content in the lesion, it will be seen as tumor in system EB scan. So we have to use technetium 99M subtraction scan for those cases. Okay, that's the answer here is Hurthle cell adenoma. So second candidate, Dr. Akash, please come.
Yes, sir.
Yeah, this is the same. All the questions are same like this. 20 years female patient presents to you with hypertension and palpitation. She gives recurrent episodes of headache and sweating. Her mother died of some renal cancer, which she is not sure. On examination of the patient, no clinical findings are suggestive of anything. So I ordered a CT scan. During the time of CT scan, she developed sweating and palpitations and hypertension. What is the suspected diagnosis, Dr. Akash? What diagnosis you suspect from this?
Sir, von Hippel-Lindau. This would be a case of the current presentation is due to pheochromocytoma.
Yeah.
Overall diagnosis could be von Hippel-Lindau.
Okay. What will I do to next to confirm the diagnosis? Why the patient developed sweating and palpitation during CT?
Sir, because it was a contrast enhanced CT and that caused the release of the adrenaline from the gland.
Very good, very good. What is the question is?
So
what
the
is,
next step, sir, would be
investigation to diagnose it.
sir, MRI would be done.
No,
Sir,
confirm,
MRI.
MRI is to locate the lesion. Confirm the lesion is by means of to
Okay.
confirm. MRI
Sir,
is
MIBI.
no,
Sir, sestamibi,
No,
MIBI or octreotide sestamibi scan.
Your answer.
Sorry, octreotide scan.
Okay, whatever you are telling is correct, but the question is, what will I do next to confirm the diagnosis? I will do one simple test.
Okay, sir. We'll do urinary VMA and.
Okay. Okay. Anyhow, I'm very happy you are knowing very well about the concept. The quiz question comes now. What is the investigation of choice to localize the tumor? You have answered it. Answer is?
Sir, it will be MIBI scan.
No, it is MRI only. What you told MRI is correct. What will be the finding in MRI? That is the quiz question. What is the finding seen in MRI of pheochromocytoma? That is the question from
salt and
yes.
Salt and pepper appearance.
Is it salt and pepper or something else? It is you are telling nearly same, but it is exactly not the correct answer. In Bayesian law, there is an image of that. Salt and pepper is for not for this.
Sir, it will.
Yeah. It is. Okay.
I am not sure about the exact.
We will give 5 marks to Akash. Okay. It is Swiss cheese pattern. Swiss cheese pattern is seen on MRI. And to confirm the metastasis only, we do this. To confirm the metastasis only, we use this MIBG scan. For locating the tumor, MRI is used. Okay. 5 marks for Dr. Akash. Please give 5 marks for Akash. Third question to Dr. Aryan from AIMS.
Yes, sir.
Yeah, this is again another clinical question. Please come. 50 years female living in Himalayas presents to AIMS hospital with a swelling in her left side of the neck. On examination of the swelling, it is movable side to side and has increased pulsation. What is the name of this clinical sign that is elicited to confirm this diagnosis? Name this sign. What is the diagnosis, first of all? What do you come? All the clues are there in the question itself. What is your diagnosis? Because only when you know the diagnosis, I'll go to the question. This is not the quiz question. So patient coming from Himalayas, that is one clue. Swelling moving side.
Sir, is it nutritional goiter?
No, not at all. It is having pulsation.
So maybe, sir, aortic.
Okay. This is, let me give you the clue. Tell me what is the sign. Carotid body tumor. This is carotid body tumor. Tell me the sign seen in carotid body tumor on examination. Yes? No?
Sir, I don't know, sir. I don't.
Okay, thank you. Nothing wrong. This is a tough question. It is actually known as a Fontaine sign. Fontaine sign is we can move it laterally, but we cannot move it vertically. The swelling can be moved horizontally, but cannot move vertically. The diagnosis is confirmed with the help of angiogram. Angiogram will show you a sign known as, what is the name of the sign? Anybody can tell now. Nobody is getting
Liar sign.
Yeah,
liar sign.
So playing of common carotid artery known as liar sign. So there is no mark for anyone in this question. So let us go to the fourth question. Biki Datta, please come. Biki Datta, you are there?
Yes, sir.
Yeah, from Guwahati Medical College. A school boy, 8 years, is very good in his studies, but when asked to write for 1 hour, he complains of giddiness and falls asleep. And on evaluation of him, he was also having some brittleness of nail and color changes. On examination, he is having a swelling above the clavicle. There is a swelling above the clavicle. What is the syndrome he developed from this history? This is a boy who is having, when he is writing, he is having giddiness. Or when he is doing something with his hand, he is having giddiness and he is feeling, falls down. He is having some swelling on palpation above the clavicle. What is your diagnosis?
Sir, is it subclavian steel syndrome?
Very good. Excellent. That is the correct answer. That is a subclavian seal syndrome. The question is, name the 3 tests elicited for this. Name 3 tests to elicit for this compression. Subclavian seal syndrome, I will give you 5 marks. But when you give...
Sir, Roos test.
Very good. 1 Roos test.
Edson test.
Edson test.
And then right hyperabduction test.
Very good. Okay, that is very good. And another one is Halstead test. So you can give 10 marks to Vicky Datta. Excellent. Vicky Datta, excellent. It is 10 marks for Vicky Datta. Okay. So coming now, fifth question to Devang Agarwal from AIMS.
Good evening, sir.
Good evening. Welcome. So Mrs. Ramai, 56 years female, complains of pain and jaundice and fever to your clinic. She is having BP 100/70. Pulse rate is 140. She is in confused status. Ultrasound shows dilated CPD. WBC count is 24. What is the next investigation to confirm the dilated CPD? So this is the case. What is your diagnosis from this case? This case is having what? Pented. She's having one pented.
Yes, sir. This is the Charcot strain in the pented. Yes, sir. Like I understood the CBD and fever and altered mental status. I'm just forgetting the pentad's name, but I
no need. That is not the question anyhow.
Yes,
What is
sir.
the investigation to confirm?
It was Reynolds pented, I guess.
Yeah, very good, very
Yes,
good.
sir.
Reynolds pented. Tell me what is the investigation to confirm the cause of dilated CBD?
Sir, will we do MRCP for this?
Yes, very good, very good. It is an MRCP. That is correct answer. MRCP will be done. Now the quiz question comes. Gold standard treatment for this case. What will you do if the above treatment fails? So the patient is now in cholangitis, whatever it is, whether it is a stone or cancer in MRCP, I have to immediately do one gold standard treatment to save this patient's life. What is it? I have to save this patient's life now because she is in cholangitis. I have to immediately put a.
So we have to put a T tube, like, so that we can drain out the bile which is being collected.
No, that is the answer for second line. First line I'm asking. You are answering for what will you do if above treatment fails.
Sir, because I remember that second step. So like we put the T tube.
Before doing a T tube, there is one another procedure which can be
so
done.
We do a lab. No, so like. Not very sure. I'm sorry, sir. I'm not very sure about.
No problem. You'll be given 5 marks, Dr. Devang. Please give 5 marks for him. We have to do ERCP, sphincterotomy, and stenting. That is that is a simple procedure, that we should be doing to reduce the cholangitis, because patient is in cholangitis. We have to do a ERCP and stenting. Okay. So the answer is you are nearly correct, but I can give you 5 marks for this. Okay. Sixth question, Radha, please. Radha is there?
Yes, sir.
Yeah, very simple question. I think always what happens, the last candidate will get an easy question. So the 10-year-old boy presented with sudden onset of pain in the right scrotum after a jumping play. On examination, he was having tenderness in the right side testis. On lifting the testis, pain decreases. What is the name of this sign? That is the question, Radha.
Sir, it is torsion.
No, you tell me the name of the sign. I am lifting the testis, pain decreases. What is the name of this sign? Lifting the testis sign is known as.
Yes, sir. Sir, I'm not remembering it at the moment.
You don't know the name of the sign, but at least tell me what will happen in torsion and what is the differential diagnosis of painful testis in this boy. The patient is having a testicular pain. There are two causes. One is torsion, another is architis. What do you think this case is? That is the question. If you tell that, I'll give 5 marks.
Sir, it is torsion.
No, it is not torsion. So that is the sign. The sign is doing a Prenz sign. In Prenz sign, when you lift the testis, the pain will increase in torsion, decrease in architis. Okay, when I lift the testis, the pain decreases in architis is a catch point. That is a very simple test we have to do. That is Prenz sign, known as Prenz sign to differentiate torsion and architis. So what will be the important investigation that must be done for torsion? Please tell me that. I should do immediately to confirm it is torsion.
Exploration.
No, before doing that, we will, if possible, we have to do for a Doppler. Okay,
Total
we have to do for a
USG.
Doppler. So I will give you 5 marks if you answer. This is actual quiz question. What is the most common cause of torsion testis?
Sir, congenital deformity, bell clapper deformity.
Very good, very good. So okay, I will give you 5 marks for this, Radha, because 5 marks you will be giving for this. If you tell another correct answer, the second quiz question, I will give you 10 marks. How will you put the incision in the scrotum for such torsion testis? How will be the incision? 10 marks I will give you if you answer this correctly. This is all questions directly from Bailey and Love, not from any other book. What type of incision you make? Okay, no problem. Radha will be given 5 marks. No, we have to put a horizontal incision including both scrotum. We should not put para-raphe incision. Horizontal incision, explore both the testes together. Okay, we'll be giving 5 marks for you, Radha. Please. That's nice. First round we have completed now because I have asked only 15 minutes from the quiz masters. I don't want to waste more time. Let us go back to the quiz round 2. Quiz round 2 is completely all the images from Bailey and Love. One by one, I'm going to put the images. Let us start with Soumitra. Please tell me what surgery is going on here. This is Soumitra, you are there?
Yes, sir. Yes, sir.
What surgery is this from Bailey and Love? This is one surgery done. All the images are taken directly from 27th edition Bailey. Just this we cannot tell. We cannot give more than 10 seconds. If you know, you tell. Otherwise, go.
Is it fasciotomy?
No, wrong. So this is Homan's operation for lymphedema. All these images are taken direct, illustrated images from. This is Homan's operation from lymphedema. Okay, so don't worry. Second question for Dr. Akash. What is operation done shown here? All the images are direct images from Bailey and Love. I don't want to beat hi-fi questions. Whatever is there in Bailey, I'm asking. What is this image?
Sir, is it done to treat GERD?
No.
It's fundoplication?
No.
Okay, Coley's gastroplasty.
No, not at all. This is, that's what you have to see. Only when you have seen Bailey images, you'll answer. This is Ivor Lewis operation for cancer esophagus. Ivor Lewis operation for cancer esophagus. Okay. Question number 3 for Aryan. What surgery is done there? What is the surgery done there? Aryan? It is an anus. It is anus shown there.
Sir, for hemorrhoids or?
Hemorrhoid, what is the name of the operation? Hemorrhoid is okay. Anus, this is hemorrhoid done, removed. What is the name of this open hemorrhoidectomy operation? If after the surgery, anus looks like a clover, the problem is over. This is a line from Bailey and Love. If after the surgery, anus looks like a clover, the problem is over. Okay, we'll go on. This is Milligan-Morgan operation from Bailey and Love. Milligan-Morgan's operation, open hemorrhoidectomy operation. Okay. So fourth question to Biki Datta. Please tell me what surgery has been done here. Correctly, you should tell. If you tell wrongly, you will not give marks. Biki Datta, this is also Bailey and Love. What operation is this? You are there?
Whipple's operation, sir.
No, you are not given marks for this. This is Longmire and Traverso operation, not Whipple's. Okay, you can see the pylorus preserving pancreatico-duodenectomy. This is not Whipple's operation. This is Longmire and Traverso operation. So no mark for this for Biki Datta because it is the most easiest question from Bailey and Love. So fifth question for Devang Agarwal, please tell me what is this instrument put and what is done here. What is this instrument? I want the name of the instrument. Everyone will tell this is circumcision. Devang Agarwal, please tell me what is this instrument.
Sir, I'm not sure, sir. I'm not sure, sir.
You're not sure. This is plastibal device, also known as Hollister device. So plastibal or Hollister device from Bailey and Love. This is used for circumcision in children less than 1 year. Okay. So this is Bailey and Love image. So last question, sixth question for Radha. Please tell me what procedure is done there in the trachea. It is another picture from Bailey and Love. Radha is there?
Yes, sir.
Yeah, please tell me what is the name of the procedure shown there. Trachea is made like something like it differently. Yes? Don't know. This is Bijart flap. Bijart flap. Bijart flap is used for tracheal tube insertion. Okay, this is for following a tracheostomy. For easy removal and insertion, we use this Bijart flap. Okay, these are images from Bailey round. Bailey round is actually easiest round. I thought all of you will be answering. So let us go to the another round, a simple round. Name the criteria very fast, only 5 seconds time. I will tell the criteria, you tell me where it is used. That's all. I will tell the named criteria, you should tell where it is being used. One, Dr. Soumitra, please tell me where is this criteria used? Miami criteria.
So it's for parathyroid to detect post parathyroid surgery whether it is.
Super Soumitra, 10 marks for Soumitra. Very good, Soumitra. This is a parathyroid excision after surgery. We have to measure for PTH level. It should fall more than 50% in 10 minutes. Okay, that is correct. Very good. Second question to Dr. Akash. Where is Milan criteria used? Akash? Milan criteria used in?
Time is up.
Sir, yes. The liver transplantation.
Yeah, okay, very good. Liver transplant of dash. Then only I can give 10 marks.
Hepatocellular cancer. Hepatocellular cancer.
Very good. It is correct. We can give 10 marks. Milan criteria is for liver transplant HCC, in HCC. Very good. So number 3, Aryan, Rosemont criteria is used in. Aryan, Rosemont criteria.
Sir, I don't know, sir.
Don't know. Okay, it is endoscopic ultrasound criteria for chronic pancreatitis. Endoscopic ultrasound criteria for chronic pancreatitis. Okay. Fourth question, Bikidata, Shionaya criteria.
Sir, is it carotid body tumor?
No.
Sir, it's neuroblastoma, neuroblastoma, sir. After histopathology, sir. Neuroblastoma.
No. It is used for TAO, thromboangiolitis obliterans,
yes,
Buerger's disease. If it is less than 40 years, bilateral, infrapopliteal, this is Shionaya criteria for Buerger's disease. These are criteria, names are not in Bayesian law. These are just for some extra point we have given here. So no marks. Fifth question, Amsterdam criteria. Divang Agarwal, easy question for you. Amsterdam criteria is used for.
Sorry, sir.
It is
I'm
used
not sure, sir. So I guess it was for pancreatitis, like no, sir. Fat embolism. I guess it was like fat embolism.
No. It is used in HNPCC. HNPCC for screening the families. 3 members in a family affected, 2 are first degree relatives, like that it will come. So Amsterdam criteria for HNPCC. So 6th question for Radha, modified Wells criteria. This is the only criteria actually there in Bayesian law. What were?
Pulmonary embolism.
Very good. Radha is getting 10 marks for this. It is modified Wells criteria is for pulmonary embolism from DVT. DVT developing into a pulmonary embolism. So thank you so much for all the participants. It was an exciting round. There are so many more rounds coming. Thank you all. Thank you, Rahul sir. Thank you for the session.
All right.
Okay, I think I have not taken more than 50 minutes of your time.
Thanks a lot, Raja Mahendran sir. First of all, I should say all 3 rounds thoroughly enjoyed by all participants. You know, it was almost a holistic coverage of surgery through many beautiful images. And when you were speaking about Ivor Lewis operation, it gave me a deja vu of my NEET PG preparation days. I'm hearing this after a long time. So, yeah. So
they are illustrated images from Bailey and Lowe. Many students will not see that illustrated images. Actually, they are drawn images by Bailey. They are not original images. They are done by Bailey. But if I draw, it will be much better than Bailey's image. It will be very vague image. That is why many students are unable to. You can see even Vicky Datta told Whipples for a Longmire and Traverso. This is very commonly done. Many of them will tell Longmire and Traverso as Whipple. That is a small difference. Pylorus is preserved. Very nice. All of them have answered very well, and all of them have a good knowledge about the various concepts. Thank you. Thank you so much, Rahul Saji sir. So I'm having one work. Shall I leave now?
Sure, sir. And we'll let you know the final scores. Okay. And I think, you know, whoever is the winner has to give us a party because you're getting a lot of money, 25,000 rupees. So has to give the quizmasters some real good treat. All right. So let's know the scores now. We'll have Nadir. Nadir, how's the score?
Yes, 5 rounds have gone. Let us know the scores. Total score is enough. Total score.
Nadir, you are muted. Nadir, can you please let us know the scores?
Hello, sir.
Yeah. Yes, Nadir.
Total scores. Total scores of the 5 rounds.
Yeah.
Participant number 1.
Soumitra, you can say the name. Dr. Soumitra.
Soumitra Jinodia, 20 points.
Okay.
Number 2, Akash, 25 points.
Right.
Number 3, Aryan, 20 points.
20.
Number 4, Bikki Datta, 30 points.
Okay.
Number 5, Devang Agarwal, 25 points. Number 6, Radha Agarwal, 25 points.
All right.
Thank you.
So, close competition, sir. Raja Mahendran, sir.
Very tough competition is going on, sir. I don't know who is going to win. Really, I wanted to see the show completely, but having one small work, keep carrying on, sir. Very tight program. I think you should keep more tough questions in the last 2-3 rounds. Otherwise,
more rounds are coming up.
Yeah. Nice, sir. Thank you so much, sir. Thank you.
And moving on to the next round. So next round will be by the master pediatrician, Dr. Sandeep Sharma, sir. He has done his MD Pediatrics from PGI Chandigarh and is currently a practicing pediatrician and a leading faculty of pediatrics in the country. Someone who is known for his clear concepts and wonderful teaching. Sir, hearty welcome to this, and over to you, sir, for the next round.
Thank you, Dr. Rahul. It's a pleasure to be, a part of this wonderful quiz. And I'm actually thinking, looking at the answers being given, should I have increased the difficulty level of my questions a bit? But nonetheless, now it is too late now. So let us start with the questions. So there will be 6 questions I will be asking. And among these 6 questions, all of them are image-based. There is a small clinical vignette related to it. There is no option I'm giving. I'm just giving you the answer. I'm just asking you the question and you are supposed to give me the answer to that. And then there will be a small 2-3 line discussion I'll be having so that you can also benefit from it. And people who will be watching this video later on YouTube, they all can benefit from it. All of these things I have made note that they have been taken from standard books like Ghai and Nelson. And the images are also very clear cut. And all of them directly, indirectly are also your potential future MCQ related topics, right? So without wasting any time, I'm just going to share my screen. So I'm just sharing my screen first of all. Okay. Is the screen visible? Just let me know once so I can start.
Yes, sir.
Is this to all of you? Yeah. So pediatrics quiz, I'm going to put it in. Yeah. Okay. Team number 1. Team number 1, identify yourself so I can show the question.
Yeah. Yes, sir. Somit.
Yeah. Hi. So let us look at question number 1. So the question number 1 is, a baby born to a pregnant female with history of oligohydramnios expired at day 2 of life due to pulmonary issues. You can see the image. The child had lower limb deformities as shown. You can see the lower limb deformities in the picture. And there was a receding small chin and low set ears also in the child. So deformities are present. This child is, as you can see, intubated, but he expired on day 2 due to pulmonary issue. What is the likely diagnosis? And your time starts now.
So this is Potter's facies and Potter's sequence.
Absolutely right. Correct. Potter syndrome. What are the pointers toward Potter syndrome that you can identify in this child?
Sir, oligohydramnios, pulmonary hypoplasia, and then the Potter's facies, typical receding small chin and low set ears.
Correct. So let us have a quick review of the topic. The answer indeed is Potter syndrome. So this is a Potter syndrome. So the points which I have mentioned here, they have been collected from standard sources. Please add it to your notes later on when you watch this video, take a snapshot or add to your notes. So what happens in Potter syndrome basically is due to any reason, majorly because of the renal involvement. Either the original Potter syndrome was described for bilateral absence of the kidneys. We call it as bilateral renal agenesis, but it can also arise due to any other condition. So there will be reduced to absent urine production. This will cause severe oligohydramnios. When severe oligohydramnios will develop, the child's lungs will not develop properly. That child will undergo fetal compression, and so deformities along with pulmonary hypoplasia will be manifesting. How to identify Potter facies? The features have been mentioned here. In addition, the cause of death in these children is pulmonary hypoplasia. So it is more common in males. Incidence is 1 in 3,000. There are 2 types of MCQs which are asked in exam. If they ask you what is the pathophysiological determinant, it is oligohydramnios. But if they ask what is the most common cause of death, it is pulmonary involvement. Both of them are past NEET PG questions. In previous years, they have been asked. There is an entity called as classic Potter syndrome. Classic Potter syndrome arises due to bilateral renal agenesis. This was the originally described. In addition, these days, the classification says there are 4 types of Potter syndrome. Type 1 is ARPKD associated. Type 2 is due to renal agenesis, the classic variety. Type 3 is the autosomal dominant PKD associated. And type 4 occurs due to posterior urethral valve. So it is also mentioned in books as obstructive uropathy and hydronephrosis, right? So excellent answer by team number 1. Moving further, let us move to team number 2. Please identify yourself.
Hello, sir. This is Akash.
Hi, Akash. So your question goes here. A child with arthritis since 3 weeks, has fever as depicted and also has a salmon colored rash. What is your likely diagnosis? What
so this is, yes, sir. I can see, sir, fever rising every day.
Yes.
And sir, this is juvenile idiopathic arthritis, JIA or JRA.
Yes, but which variety? There are multiple types of varieties. If you are able to tell me the type of JIA, you get complete credit.
Sir, oligoarticular.
No. Oligoarticular will have 4
Sir,
or less.
Still's disease. Is this Still's disease?
Yes, it is Still's disease. I'll give it to you. It was a difficult thing, but you get it right. Still's disease is the older name. We now call it as systemic onset GIA. It is a chronic arthritis in the children. See, a child who's having arthritis for age of onset is below 16 years, and the child is having a chronic arthritis, and other known causes are ruled out. You suspect juvenile idiopathic arthritis in the child. There are multiple varieties of that. You have oligoarticular, you have polyarticular, you have systemic onset GIA, and you have enthesitis related GIA. Systemic onset GIA is a serious, life-threatening systemic infection, systemic manifestation. What you can see in these children is the typical quotidian fever. What is quotidian fever? Please understand. Look at these dates which are mentioned. Within 24-hour period, there is a peak of fever which is coming, and then the fever is going below the baseline. So below normal temperature, within 24 hours, there is a peak, then the temperature dipping below baseline. Peak and temperature dipping below baseline. If it occurs on a daily basis, we call it as quotidian fever. Quotidian fever can have an infectious origin, as you see in 2 different varieties of malaria infecting the person at the same time. It can also occur in non-infectious condition. They can ask you as a one-liner. Non-infectious condition is systemic onset GIA, also called as Still's disease. And this is the typical rash found in these children. So what are the take-home points? So please give credit to Akash for this question. So systemic onset GIA, arthritis of 1 or more joints lasting 6 weeks or longer, quotidian fever for 2 or more weeks, and any one of these. Evanescent pink rash on the trunk. When I say evanescent, it means it is a self-limited rash. Please understand that this is one rash which shows a positive Cobner's phenomena. What is Cobner's phenomena, Akash?
Sir, on trauma, the rash spreads.
Yes. So they can create a integrated derma pediatric question. Name the condition where Cobner's phenomena is seen in a child with arthritis. The answer will be systemic onset GIA. And then serositis, so pleuritis, pericarditis, ascites, etc. can develop. There will be hepatosplenomegaly, and there will be generalized lymphadenopathy. So this is also considered to be the diagnostic criteria: arthritis, quotidian fever, and any one out of these 4. Systemic onset GIA requires corticosteroids. Please remember, the usual arthritis GIAs, they respond to non-steroidal anti-inflammatory drugs. Systemic onset GIA requires short course of steroid followed by biological agents like anakinra, infliximab, monoclonal antibodies, etc. will be needed. This is how, that is why there is a concept which says that systemic onset GIA is auto-inflammatory disorder as compared to autoimmune phenomena for the other conditions, right? Let us move further. Let us look at question number, team number 3, please identify. So he gets 10 marks for this. Let's look at team 3, please identify.
Yes, sir, Aryan here.
Hi, Aryan. So your question goes now. A term unit was found to have excess pink-red discoloration on one half of the body. This shall increase on keeping that side dependent, and on changing the position, it will also sometimes shift. The child did not have any other issue. The child is absolutely fine. What is this condition known as? Can you see in this child? The time starts now. Can you see one half of the body is pink in color, one half is normal. And if you tilt the baby, this pink discoloration will actually increase. What is this condition known as?
Sir, is this Harlequin baby or not?
Is it Harlequin baby or it is something else related to Harlequin? Harlequin baby because it's a very generic term.
Sir, Harlequin rash?
No, there is no such thing as Harlequin rash. Just tell me, what is the reason for that? And do you need to do anything in this or not? I'll give it to you then.
Sir, it will subside, I guess, with age.
Taking a guess?
Yes.
It's okay. Yes, you are right. This child is having Harlequin color change. This patient is having Harlequin color change. Harlequin color change is considered to be a transient neonatal phenomena. it does not require any therapy. There are multiple types of Harlequin words that you will find here. So Harlequin color change does not require therapy. So it is a self-limited phenomena. In the first week of life, you will find one half of the body is pink in color, one half of the body is normal or too pale in color. It occurs due to autonomic dysfunction. It is not permanent. Changes with posture, changes with temperature also, does not require any therapy. There are other things known as Harlequin ichthyosis, Harlequin baby, which are actually called as, which are actually pathological conditions. But Harlequin color change is a self-limited phenomenon, right? So because you identified Harlequin, but Harlequin baby is incorrect, so I'm afraid you'll get 5 marks out of this. So please add +5 to Dr. Aryan's score here. So moving further, team number 4, please identify yourself.
Hello, sir. I'm Vicky.
Hi, Vicky. So Vicky, your question goes now. A baby was delivered prematurely to an unsupervised primary gravidae pregnant lady. The baby had malformation as shown and died within 2 hours of birth. First of all, tell me what is this condition? Then I'll start the time.
Anencephaly.
Yes, absolutely right. What dose supplementation of vitamin? Which vitamin will prevent this from occurring?
Folic acid.
Folic acid, yes. So the question is asking what dose supplementation you will give. So tell me the dose.
So 10 times the normal dose, that is 4 milligram. So
the question carefully. The question is saying what dose supplementation could have prevented this from occurring.
Oh, prevention.
And it is a
Yes, sir.
primary gravida pregnant lady.
So I know the answer, sir.
Yes.
You can ask them.
Yes. Okay. Tell me about the doses and I'll give it to you. Tell me about the doses.
So for prevention, it is 400 microgram, which is started when the couple plans pregnancy or 1 month prior to planning the pregnancy, and it should be continued up to 6 months after. During the throughout the pregnancy, along with iron, folic acid, folic acid.
Excellent. This is what I wanted to hear. Yes, and
from this second trimester onwards, along with iron, it is given with folic acid. It's continued throughout the pregnancy, and after 180 days after pregnancy, also it is continued, sir.
Correct. And in case there is a previous baby with, suppose this lady now gets pregnant again, what will be the dose?
So 10 times the normal 4 milligrams, sir.
So it will be 4 milligram per day. So excellent. So folate supplementation dose 0.4 mg per day started 1 month before conception. So we call it as periconceptional supplementation, and it should be minimally given according to CDC till 12 weeks. 12 weeks is mandatory. After that, we do give it, but as a part of iron and folic acid supplementation. So remember that the normal dose is 0.4 mg per day, that is 400 micrograms per day. If there is a previous affected baby, 4 mg, that is 4,000 micrograms per day. And periconceptional word is important. Till 12 weeks, it has to be given in these doses. After that, iron and folic acid supplementation can be given. So please give good credit, complete credit, Vicky. So thank you, Vicky. Next, move to team number 5. Team number 5, please identify yourself.
Good evening, sir. This is Devang Agarwal.
Good evening. Good evening, Devang. So your question goes here. So 1-month-old child was being evaluated and he was found to have a positive reflex as shown in the image. What is the reflex which has been done? What is this reflex?
So this is the asymmetric tonic neck reflex.
Absolutely right. Can you tell me about what is the alternative name of this reflex?
This is called, I guess, Superman's, like, no, not this, so like, extension and flexion. Like, I'm not sure about the other names. Like, I know the.
It's okay. It's okay. This is only for you. You give the answer directly. It is also called as fencing posture reflex. You have that fencing sport. They wear a white gown, white clothes, and they hold a sword. So before they start fighting, they have a posture like this. On turning head to in a supine position, on turning head to one side, there is extension of limbs on the affected side. As you can see in this child, can you see there are extension on the same side and flexion of the limbs will occur on the opposite side. So this is symmetric tonic neck reflex. It is also called as, please add these points, fencing posture reflex, on turning head to one side in supine position, extension on same side, flexion on opposite side, appears just before birth, disappears at 4 to 5 months postnatally. And also remember that complete turning over in bed, that is prone to supine and supine to prone will be able to come only after ATNR goes away. So that is a nature's way of preventing the child from turning over and falling from the bed. So nature has all these reflexes for a reason, right? And there is also symmetric tonic neck reflex. Is it present at birth or not?
No, sir. Symmetric tonic reflex is not present at birth. Like it's gained later.
Yes, it appears later. So thank you for the correct answer. So Devang has answered correctly. It is ATNR. For entrance exams, please remember that all these reflexes are important, but the named reflexes, the reflexes with their alternative name, or those with a dramatic presentation. Morrow's reflex, ATNR, STNR, parachute, Landau reflex, 5 or 6 reflexes, age of appearance, disappearance, and how to identify. Please be thorough with them. Let us move further and let us go to team number 6. Team number 6, identify yourself, Radha.
Yes, sir. Yes, sir. Hello,
You can
sir.
see, hi Radha. You can see the screen.
Yes, sir.
Okay, so your question goes here. So a 2-year-old child with severe acute malnutrition and a weight of 7 kg is found to have white spots as shown in the image. You can see the typical feathery extension, the foamy lesions called as white spots present in the child. Obviously, you need to give vitamin A. What dose of vitamin A you shall use in this child? Before you answer, be careful. You can take your time. You know the doses, read the question carefully and give the answer.
Sir, as the weight is less than 8 kg, so we'll give half the usual dose, 50,000 international units.
What dose are you going to give in this child?
50,000 units.
Final answer,
No,
50,000?
sir, 1 lakh unit.
You want to change your answer?
Sir, 1 lakh unit.
Are you sure? I'm
So
asking
1
for
lakh
the
international units.
Are you sure?
Yes, sir.
Because you have changed your answer, so I'm
Yes, sir,
asking.
1 lakh units.
Okay, so Radha has answered absolutely correctly. It is 1 lakh international units of vitamin A. Why it is so? There are a few points about vitamin A supplementation that we should know. So vitamin A megadose supplementation, please understand and remember these points. Whenever you have a patient, whenever you have a prevention of vitamin A deficiency, for prevention, you give every 6 monthly. But for treatment of vitamin A deficiency, if there is a non-acute malnourished child, the mega doses are given on day 0, that is when the child comes, 1 day later, and then 4 weeks later. In a severe acute malnourished child, they are given on day 0, that is at the time, next day, and then 2 weeks later. So this can be a potential MCQ. This can be a potential Viva question for everyone who's listening to this. Small little things can make a difference. So non-SAM child, 4 weeks will be the third dose. SAM child, 2 weeks will be the third dose. Age-wise doses are less than 6 months. This everybody knows, 50,000. Then 6 to 12 months, 1 lakh, and more than 12 months, 2 lakh. But GAI, as well as all the guidelines, they also say children more than 1 year weighing less than 8 kg should receive half the age appropriate dose. Also remember that in case you are giving parenterally, there also the dose will be half the age appropriate dose, right? So this is the oral supplementation doses that we have talked about. So please add these points to your notes also. And I think everyone has done extremely well in this session. So can you just announce the total scores again? Where do we stand right now?
All 6 rounds, sir?
Yes, please.
Sir, participant number 1, 30 points.
Okay.
You can say the name as well, Nadir. Soumitra.
Okay, sir. Participant number 1, Soumitra, 30 points. Participant number 2, Akash, 35 points. Participant number 3, Aryan, 25 points. Participant number 4, Vicky, 40 points. Participant number 5, Devang, 35 points. And participant number 6, Radha, 35 points.
This is more close than we had expected, Dr. Rahul.
Yeah, absolutely right.
I think it's going to go to the wire, as they say regarding the matches also. So I do have a bonus question also ready with me. In case you do need my support in the end, do let
Sure,
me
sir.
know.
Sure, sir.
So I'm turning off my screen. It was wonderful interacting with all 6 of you. It's a privilege. All of you, I wish you the best of luck from my end. And regarding pediatrics, do feel free to ask any doubts whenever you have, and do well, do justice to your talent, and do well, irrespective of the result of this quiz. So thank you, Dr. Rahul. You can continue with the next round.
All right. So the quiz is going on, and it's turning out to be more exciting. And I'm sure that you are all, the viewers, looking forward to who is going to be the final winner. So the next round is again a very, very interesting round. And this will be conducted by none other than one of my dear students and himself a very good quizzer, Dr. Anirban. Anirban, hearty welcome. And Anirban is going to conduct the next round. Anirban, you are muted. No, you're muted. You're muted now.
Hello.
Yes, now you're audible.
Yes, sir. Yes, I'm just setting up my screen sharing right now.
Sure. So Soumitra, Aryan, Devang, Akash, Vicky, Radha, everyone, how's the quiz going?
So it's awesome.
Very
Wonderful.
interesting.
I know Vicky in this group. The others, you might be there in my Telegram groups, but but personally, I know Vicky, but Vicky, have no mercy. I'm going to ask you the toughest question. Okay. All right. Okay. So 2 more rounds of medicine, they are coming up. All right. So we are going to have 2 more rounds of medicine. So even for medicine also, the first round was just a simple, basic clinical skills round. And when it comes to the next round, it will be of slightly average toughness. And the last one may be slightly more on the tougher side. So Soumitra is already laughing, he feels he wants only simple questions, right, Soumitra? All right. Okay. Good. So like any one of you who's an intern now, I think Radha is an intern. I know Dr. Radha.
Yes, sir.
Radha, yeah. So Radha is there in my group as well. So Radha, I know, is an intern. So Aryan, Soumitra, Aryan?
Sir, I'm third prof student. Third prof.
Third prof. Okay. Soumitra?
Yes, sir.
Sir, I'm an intern.
Intern. Okay. Okay. All right. And Devang?
Sir, I'm a third year student, sir.
Third year student. So, okay. Yes. All right. So good to see, even during the prelims round also, we had candidates from all sorts of representation from all years. So Anirban, in case you need more time, I'll conduct 1 round. In case you need. Anirban? You're muted.
I think Anirban sir is saying that he needs the co-host for, I think, sharing.
Okay. Okay.
Yes, sir. Yes, sir.
Yeah.
Sir, am I audible?
Yes, you're audible.
Yes, I need the sharing part possible.
Yes. So can you please make Anirban?
The laptop one, which I have joined.
Yeah. So Anirban had logged out. So Anirban has logged in with 2 devices. So please make that second device also the co-host.
The laptop one, not this one.
Anirban, just check now. I think it is.
It's showing rejoining, sir. Yes, sir. Sir, it's still showing disabled.
Yeah, now please check. Now please check.
Yes, sir. Yes, I can do it.
Hi, just a second. I'm joining on the. Do we need the buzzer for this?
No, you don't need the buzzer.
Okay, got it.
Anirban, you can go for the PowerPoint. Yeah, slideshow.
Yes, sir. I've gone. It's not showing, right? I don't know. So now it's showing, right?
Yes, we can see the PowerPoint.
Hello?
Yes,
Yes,
sir.
sir, we
All
can see the
good. All good.
instructions.
I think you can take it from here. All good. So yes.
Yes, sir. So I'll take this round from here. Now, like I want to know from the scorers who like what is the order in which the marks are there. So I don't want to go in the conventional way of starting from the first team and the team one getting to face the brunt of the first question. Scorers?
Nadir?
Yes, sir.
Who are the like the top scorers right now? In descending order, I want from rank 1, 2, 3. If they're tied, then you can say the 3 and then the other teams.
Okay. Currently, the leading participant is participant number 4, Vicky Datta, with 40 points. And we have three participants with 35 points.
Okay.
And a participant with 30 points standing fifth. And participant number 3, Aryan, with 25 points standing 6th.
Okay. So I'll start with Vicky this round. So he is the one who is at the top right now, and I think he should be the one who should get the first chance to see the round. And I'll explain the instructions. Vicky, are you there?
Yes, I'm there.
Yes. So this round will be basically, as you could see in the previous slide, it was an integrate please round. So you have to integrate the questions which I will show you. There will be, I think, 2 connects and 1 clinical case, or there will be 1 long case, 1 short case, and 1 connect. This will be the basic pattern of the rounds, and you can go through the instructions right now. There will be no pass or pounce, first of all, to maintain transparency. There will be no pass or pounds. Each set will have 3 questions in total. Each question will carry 10 marks and 30 seconds for the team to answer. After I read out the question, you will get 30 seconds to answer. And there will be a final integrating question to all the 3 topics asked. Question can be answered only by the participating team, right? So there will be a final integrating question, and this is where it gets very interesting. If you guess the answer before the question is displayed, and you will get only 1 chance, you will get 40 marks. And if you answer it after I display the last slide, the last question slide, which I will display after the 3 questions, then you get 20 points. There will be no negative markings. And for the connect questions, there will be each connect question will have 1.2 marks each for each image you are explaining to me, and 5 marks at last for the each connect, right? And for the clinical VNets, you will have part marks, maybe 5 plus 5 or 2.5 plus 2.5, like that. There will be part questions. So, and my decision will be final here. And if there is any issue regarding the answers, then you can definitely tell us, and we will definitely look forward to genuine sources for the answers, right? Vicky, are you okay with the and every participant, are you okay with the instructions?
I had
one doubt I have.
Yes,
Yes.
you can go for it.
Suppose we if one set is shown to us in the, we will have 3 questions, right, in the set.
Right.
So suppose I explain the images. If there is a image based vignette, then suppose I don't get the correct diagnosis, won't I able be to move to the next question?
Yes, you will be able to move to the next question. That you will be able to do. Don't worry, I'll display the answer. But for that thing, if you don't get the answer, you will find it a bit difficult in the integrate part. So there comes the trick.
Okay. Suppose you will not tell the answer after the one set is displayed. It's like one question set.
No, I'll display the answer. I'll display the answer.
Then how? Then we'll know. Then we'll know the answer.
No, you won't know it so easily. It's very specific. It's like, very specific.
Suppose the first slide.
Right.
Okay.
Suppose suppose you have a question on tropical splenomegaly, and then a question on a massive this myelofibrosis, and then you will have a question on, say, hairy cell leukemia. So you will have to connect between these 3. So from the first question, maybe you won't be able to say what maybe in the second or third question you might be able to point out what's the common link between all this, and it will be very specific. Not like these are some diseases which are there, or these are autoimmune diseases, these are malignancies. You cannot say a very wide answer like that, but it has to be very specific, and it is very unique to this set of 3 diseases, right? So it's like better
syndrome,
no, it's not like a syndrome. It can be related to the pathogenesis. It can be related to molecular any molecular gene which is involved. So it can be any out of the 3. So am I clear with the instructions?
If we guess the answer in the first set, we will get negative mark, or what?
No, you won't get negative marks, but you won't get to attempt after the final third question is shown. You won't get a chance to answer in the final round.
Okay. Thank you.
So everybody is clear? Any questions?
So just to clear, so the first question is displayed, and I'm not able to get the 10 marks. The second question will still be displayed.
Right. It will still be displayed.
Okay, got it.
It will still be displayed. So, Vicky, are you ready?
Yes.
So we'll move on. Which one will you choose?
Dr. House.
Okay. So you get set to Dr. House, and here goes. I'll read the question, and then the time scorer will maintain 30 seconds, right? So you won't get more than 30 seconds. I'll read out the question, and then you will say with me. You will get 30 seconds to answer. So connect and explain these 4 images. Your time starts now. You should start answering within 30 seconds at least.
First of all, the first image is abdominal distension, like organomegaly. Second images has some past positive material.
Okay.
Third image
So
is
what?
of hepatocytes. Liver hepatocytes showing foamy cytoplasm, I guess.
Okay. Okay.
The fourth image is fibrosis in the liver image section only. Reticulum
Right.
fibrosis.
So can you connect to that answer?
Time is up.
Okay. Okay.
Is it?
Sure. Yeah. You can say the connect if you can.
Is a liver disease? Okay.
No, you have to
Alpha
specify.
one. Okay. Alpha one antitrypsin deficiency.
Okay, I'll give you the part. You don't get the full connect, but you have explained some images correctly. So yeah, so this is obesity which I was showing and not abdominal. Yes, you can say it is abdominal distension, but again I was measuring that waist circumference. So I think obesity was a specific pointer, and that was indeed past thinning of liver, and I meant to indicate alpha 1 antitrypsin deficiency, or even if you want glycogen storage disease, you can take it. And the third image was actually very important. It was ground glass hepatocytes seen in chronic viral hepatitis, and that is HBV. And then the third, as you said it correctly, it is Masson trichome stain used to detect a cirrhotic liver. So the final connect is cirrhosis. So Bicky will get, I think, B and D correct. So 2.5 marks for him in this round. Scorers, please note, 2.5 marks for him. So Bicky, shall we move to the next question?
Yes.
So a 60-year-old lawyer came with a history of gradual onset dyspnea on exertion and dry cough over 2 years. It is not associated with any paroxysmal nocturnal dyspnea, orthopnea, bilateral limb swelling, no history of joint pain, dry eyes, painful blurring of vision, muscle weakness, episodic pain and discoloration of digits, no history of radiation exposure due to other past conditions, no similar family history. He's a smoker for 35 years, smoking 1 pack a day. On examination, you can see what are the vitals. I'll give you 5 seconds to see the vitals. And then other general examination signs, pickle is negative except for a clubbing. Right. And RS examination, you can see reduced tactile fremitus is there, reduced chest expansion, impaired note on percussion over axillary, infraaxillary and infrascapular area, bilateral end inspiratory fine crackles over all the areas. Right. And now the HRCT is showing you certain findings. You can read that, and then you can say me the diagnosis and 2 drugs improving survival in this condition. Your time starts now.
Interstitial lung disease, NSIP, I guess.
Are you sure?
Interstitial. UIP, usual interstitial pneumonia.
So give me a final diagnosis.
Okay, UIP, ILD, and the drugs are nintedanib and pirfenidone.
Right. I'll give you. I'll give you 10 points only. Because if it would have been good if you would have specified it a bit more, but I'll give you 10 points here because you perfectly noted the his radiological diagnosis and the 2 drugs which are useful in this condition. Because this is the diagnosis which I would have looked for is idiopathic pulmonary fibrosis. I've taken a quite extensive negative history, right, to rule out other causes of UIP also, which is rheumatoid arthritis. So yes, you get 10 points here. So it's idiopathic pulmonary fibrosis and the 2 drugs improving survival, not very modestly though, 6 months or 1 year maximum, nintedanib and pirfenidone, right? So can we move, do you want to try the third thing? Third question or the final connect in
No.
now
Next.
cirrhosis and you want to go ahead? Okay, fine.
Yes.
We'll go ahead with the third question. So yes, you have to connect and explain all these 4 images. Your time will start now. You have to start answering by 30 seconds.
First is chloramphenicol.
Okay.
Okay. The third image is, I guess, autoimmune hemolytic anemia. cold paroxysmal cold hemoglobin.
No, that is a test. That is a test. You have to see
Donald
that.
Lens. Okay, that one. Okay, the fourth image is L-thrombopac. That's and thrombopoietin agonist drug. Then the
Okay, right. You are right.
then second image is the
Yeah.
okay. The second image is some hypopigmentation on the neck area.
No. You can. Okay, you can say me the connect. I'll give you a final some seconds to answer the connect if you can. You have answered L-thrombopac, chloramphenicol, then maybe AIHA, which you think it is. And there's a second image showing some nail features and skin features. If you can connect them. There's a common theme. I'll give you 5 more seconds maximum.
Is it
it's a bit
TTP
tricky.
around?
What?
TTP.
TTP. No. It's not the correct answer. But I'll give you 2.5 points for identifying the drugs, and there will be certain giveaways points which are there in this connect. But since you don't get the connect, I'll show the answer. So the first image is actually chloramphenicol and then L-thrombopac. I was basically pointing out to a condition in which one is an inciting factor and the other is used for the treatment. And the other test which is shown in the third image is the HAMS test, right?
Oh,
so
yes.
HAMS test is for PNH, paroxysmal nocturnal hemoglobinuria, and you see certain nail findings of skin, nail, and mucus and the striations which are there, which resemble lichen planus, but it is actually a genetic condition. This triad is classical of dyskeratosis congenita. So finally, the connect comes to aplastic anemia, right?
Okay.
So here you get 2.5 points. So now you have 3 questions, right? You have 3 answers to cirrhosis, idiopathic pulmonary fibrosis, and aplastic anemia. So do you want to try for the answer? I'll give you some points to think, or you want to see the final slide? You want to go for 40 or you want to go for 20?
Can we guess the answer, or if you get wrong, we cannot go?
No, if you get wrong, you cannot go to the next.
Okay. Next slide.
Okay. So I'll give you 15 seconds for this to connect these 3. Your time starts now. Three conditions you have to connect.
Fibrosis?
No, molecular pathogenesis. 5 more seconds.
15 seconds is up.
Okay. Final chance, Vicky. Wild guess. Something related to the molecular pathogenesis of these 3 degenerative diseases.
The time's up, sir.
Okay. So I'll.
So yeah, unmute.
Anyone from the participants who want to maybe try?
Sir, is it related to telomeres? Like telomeres?
Yeah, right. You are right. Unfortunately, there is no points for passing, but that's brilliant. It is very difficult to get, but you have to. That's the hang. You have to keep in mind all the 3 diagnoses, and maybe you will connect at the end of the 3 questions. So yes, this is a case of telomere attrition diseases, right? So I'll move on to the second. There are 3 teams who are leading right now, right? Who are those 3 teams who are leading after Vicky?
Participant number 2, Agash. Participant number 5, Devang Agrawal.
Okay.
And participant number 6, Radha.
Okay. That's fine. So we'll go ahead with Akash. What do you say?
Yes, sir, that will be fine.
Okay, sure. So which one do you want to choose out of these?
Sir,
Rahul is already gone.
Sir, I'll take the middle one, the first row middle one.
So that is Dr. Chase. This one, right?
Yes, sir.
Okay, fine. So you get set 1. says. So again, 3 questions. The first one is coming up for you. I'll read out the question. 37-year-old salesman presented with the complaints of tingling of hands and feet for 4 days and heaviness of lower limbs for 2 days, which was progressively increasing. It was not associated with any back pain, tightness of muscles, tremors, fasciculations, bowel, swaying of body while moving, bladder symptoms, and facial deviation, eyelid droop, swelling difficulty was noted. History of viral flu-like illness 13 days ago. No history of trauma, excruciating back pain, vaccination, fever with night sweats. No history of other comorbidities. On normal examination, you can see patient was normal, vitals were normal, no pickle. On proper CNS examination, bulk of the muscles were normal. Tone was reduced in major lower limb muscles and upper limb, sorry, that's typo. And power testing revealed symmetric 3/5 power of proximal hip and knee joint muscles and 4/5 of proximal shoulder muscles as well. The DTRs were as follows: knee and ankle jerk were absent, biceps and tricep jerks were absent, supinator was absent. Plantar response was mute on both sides. On sensory examination testing, you can see proprioception, vibration, fine touch were predominantly lost in lower limb. Other cranial nerve, higher mental status, cerebellum, spine was normal. So what is your diagnosis out of all this and treatment of choice? You get 5 + 5 and your time for 30 seconds starts now.
Sir, can you go to the previous slide?
Your time is 30 seconds. Note that.
Sir, is it Guillain-Barré syndrome?
So you want to go with it? And the treatment of choice?
Yeah, the treatment of choice is IVIG or plasmapheresis.
Yes, yeah, you are absolutely correct. I'll give 10 points to you here. Great, that is a very good answer. That it was not a difficult question, but when a CNS case comes, you tend to be a little baffled. But here he maintained his nerve. So, should I move on to the second question?
Yes, sir.
Okay, sure. So I think this will be this is the answer. I did not had the necessity to show the answer, and so you will have the second question now. Connect and explain. You see 4 images, and you have to connect and explain to me. Maybe then say the answer, and your time starts now. 30 seconds.
Sir, flow volume curve is showing obstructive pattern.
Right.
Sir, I can see some coffee bean nucleus in first image.
Okay, and the third and second.
Retinal microhemorrhages.
There is a certain other finding that is circled.
Arteriopathy.
That's okay. Then.
And is it seen more in people who just got married?
Time is up. 30 seconds.
No, okay. Third image is something related to marriage, the ceremony that is going on. So.
Fere, I don't know.
Oh, no. So can you say the connect if you can? Just wild guess.
The time's up, sir.
Yeah. You can guess the connect and I'll move on to the answer. One last chance.
Pseudoxanthoma elasticum.
No. So it was a bit tough. The connects will be a bit tricky and tough. So you have to be a bit faster. So this is basically the first image of the Hamazaki-Weissenberg bodies. You can see ferruginous bodies and the macrophage like images which are there with that specific coffee bean nucleus. So which I was not looking for. I was looking for that histopathological description. So this is a characteristic and Schaumann bodies are also seen. This is a calcification here. So this is a histopathological description of sarcoidosis. And this is garlanding ceremony, so garland sign. And this is an obstructive, as he correctly pointed out, this is an obstructive pattern. And 50% of patients of sarcoidosis have obstructive pattern of lung disease, which is very much contrary to what people know, that is restrictive lung disease. And this is periphlebitis retinae. It was circled because there was retinal arteriolar sheathing here. So that is the final connect, and Akash will get 1.25 points. He got only the obstructive pattern one correct. So yes, that's the final connect. So you have GBS and sarcoidosis, right? So you can, should we move on to the third question?
Yes, sir.
Okay, fine. We'll move on to the third question. The question goes like this. You have 4 images, connect and explain. Your time starts now.
Sir, the blood smear showing Maltese cross babesiosis. Then the ECG showing Wenckebach phenomena, type 1
Right.
heart block. This is showing me a USA state, not able to know which state.
Great.
And the hand is showing some erythema on dorsum of hand.
So can you guess the connect from this, whatever 4 images?
Is it Lyme's disease?
Okay, I'll go with the answers. So yes, it's Lyme's disease. It's very good. It was a very good connect. This I'll give this 2 images, right? First and second image you got partially correct, but not the fully. So I'll give you 1.25 points for the whole thing, and 1.25 and 1.25 each for the so 3.75 and 5. So Akash gets 8.75 marks in this question. Scorers, please note 8.75. So first image is the Connecticut state in USA, and this is erythema plus atrophy, which is being shown, which is characteristic of the 3rd stage of the disease, ectodermatitis chronica atrophicans, as it is said. This is heart block, which is characteristic of the initial disseminated phase of Lyme's disease, and this is Maltese cross appearance and babesiosis, because both of them might coexist in the same patient because it is carried by the same tick. So that's the connect. So it's a very good answer. It's a very good answer. He might have said babesiosis after this thing. So it's a very good answer. So you have 3 diseases right now, Akash. Do you want to go for the final integration, or you want to see the slide? What you want to do? You get only 1 chance and 1 choice.
Sir, I'll see the final slide.
Okay. We'll go on with the final slide. This is for 20 marks. So you have 3 diseases. You have kept them in mind, right?
Yes, sir.
So yes, you will get 15 seconds. Your time will start now.
This is facial nerve. 7th cranial nerve.
No, you have to be specific. You have to be. Yes, you are correct. That's the correct answer. I'll give it to you. So 20 marks to Akash here. He gets the final connect right, and he did not, because GBS, Lyme's and sarcoidosis might have rung a bell to him. Still, he did not go for the final connect in these 3 diseases. He perfectly waited for the opportunity, and this is how safe playing will help you in this quiz, because some rounds after this will have negative points. So Akash, well done. So we'll move on to the next team. Who was the second and third? Aryan and Radha, no? Scorers?
Devang, sir.
Devang and Radha. Okay. Sure. Devang and Radha. Devang, are you there?
Good evening, sir. Yes, sir.
So we'll go on.
Yes, sir. Sure.
What you want to choose right now? You are a 3rd year student.
Yes, sir. I'm not sure. I guess I will take his doctor's best friend, I guess, James Wilson. Let's go with
Wilson. So you want to go with some oncology questions?
I guess.
No, those won't be oncology questions. So here you go. This is set 5. So shall we move on?
Yes, sir.
So this is the connect and explain. You have 4 images. You can see some 4 images being shown, and you have to. They are quite some are self-evident. You can connect and explain, and your time starts now.
So the 4th image show there's a Superman sign in the child, like whenever they are extended, and tuna fish is a toxin, tuna fish toxin, and this is like Thanos gauntlet, like
what does it show?
I'm not stones and gauntlets, and like in the 2nd case, I guess there's Botox toxin going on, like she's applying the injection there.
Okay. I'll consider the images, but some final connect. Can you just reshape? You are very close, but somewhere you are deviated.
First is thumbs.
Time is up.
Final connect.
Sir, I'm not. Sir, is it like tetrodotoxin poisoning something?
So why will Botox come there?
No, sir. Not sure, sir. I'm not getting.
Okay. So I'll give you 1.25 points for this image which you have identified. This is correctly injection given into the sternocleidomastoid, and it's probably Botox. And this is tuna fish, canned fish, which is there. I'll give you 1.25 for this, but that is not Superman sign. That is actually floppy head, which is being shown, loss of tone. So you get 2.5 points. You don't get the final connect. You are very close. That's why you should not think too much. So the final connect is botulinum toxin. So the first image was a SNAP, which was being shown. And SNAP 25 synaptobrebins are proteins which are targeted by the toxin. And that was injection Botox, which was given in sternocleidomastoid for dystonic torticollis. And that was canned food, a canned tuna food, which is most commonly associated with foodborne botulism in the adults. And that was floppy infant, which is seen in infant botulism. So quite a easy one you missed. Devan?
Yes, sir.
Okay. So you get 2.5 points. So shall we move to the second question?
Yes, sir.
Okay. So you are an intern posted in a rural PHC and it's your second night duty. At 5 a.m. you suddenly are woken up by a crowd. A 35-year-old female villager is brought to you by her husband and in-laws with sudden onset of ptosis, double vision, inability to move the upper limb and get up from squatting position. There were no other symptoms. So you can skip the second question because there is no pass round, because it was thought it is best to avoid pass round to maintain transparency. So what is the next best history and examination will elicit? What do you think is this thing? What is the first thing that will come in your mind in this setting, and what is the next best history and examination will elicit? Your time starts now.
So this might be like a history of any food poisoning because of the weakness. So there has to be some food poisoning which is causing this weakness. And
Just
we'll
think,
measure.
patient is coming at night to you with sudden onset of ptosis. There is no other history, no other symptoms. Food poisoning will just have ptosis.
No, so like this has to be like botulism toxin, which can actually present like this.
In a villager, you are in a rural PHC. You'll get botulism that commonly in it.
No, sir.
30 seconds you have. It's the first thing which will come to your mind. In a village, you are there. The patient comes to you with some neurological symptoms. What will come to your mind, and what is the next best history and examination?
Like in a hysteria, something like we say, not able to connect.
At night, the patient comes. There are no other symptoms.
Not sure, sir.
And these are okay. So you're not sure. So I think any interns who would like to guess this question, anyone who has gone through rural postings or even met any posting. Interns, Soumitra, Biki, anyone?
Snake poisoning.
Right. It's the correct answer. And what snake? What snake specifically at this point of time?
Cobra.
No, guys. It's not cobra. At night, cobras don't bite.
Great.
Yes, great. It's great. And great will not have any other symptoms. Cobra will still have that bite sign, and they are silent killers. Krates are silent killers. So that's the next best history which you will elicit. You would ask for history of sleeping on the floor, any sight of snake within or around the house, any mild pain or paresthesias. That might be the only symptom in crate bite. And examination, you have to actively look for the snake bite in the exposed regions and look for dangerous signs of neurotoxic snake bite. That is very important. Neck hold and neck flop in this case, and breath holding. And also you will do 20 WBCT in any case of snake poisoning. So that's the minimum you can do in a PHC. And yes, the first diagnosis that you will have in your mind is a case of crate snake bite. Actually, this was a case of quadriparesis, right?
Yes.
And the differential will be GBS, myasthenia gravis, but there were no other symptoms or no other past history. So that is the first diagnosis that should come to your mind, and you should avoid missing this.
Yes, sir.
So you have two questions here, Botox and Create Bite. So shall we move on to the third question?
Yes, sir. Third question.
Okay. So you have to connect these 4 images. You have 4 images here, and you have to connect and explain. Your time starts now.
So second is like image of a nerve stimulation, which is going nerve stimulation, and third might show that there is tongue atrophy and tongue dryness, and
Yes, dryness. I'll take
fourth
it.
is due to calcium alpha to delta. So these are some calcium channels.
Yes,
Fourth
calcium channel, dry mouth, and then some nerve thing. And then
yes,
what
sir.
is the?
This might be so I'm not sure about the first image. So this might be Lambert-Eaton myasthenia syndrome.
So you the what is your final connect?
So this might not.
What is the first image? I'll give you 5 more seconds. Your time is up. You're there. You are there.
So this should be pulmonary lung carcinoma. So it might be LEMS, like Lambert-Eaton myasthenia syndrome, due to.
I'll take it. I'll take it. That was brilliant. That was brilliant. But I'll be a bit strict here. This was actually an repetitive nerve stimulation, which is showing increasing response. So I won't give points for this. I will take this calcium channel thing. So you get 3.75 points and the final connect. So 8.75 points here, right? So you get to answer the final clue now. So you are correct. And now the final question. So you want to go with the answer, the slide, or you want to answer before, or you want to be safe?
I guess I would like to be safe.
Okay. So you have 3 diagnoses. Please keep them in mind. What is the common link to pathogenesis in all these 3 conditions? You saw Create Bite, Botox, and Lambert-Eaton. A simple common thing. You should not think of too many things. In all those 3 things,
There
very
is
specific.
neuromuscular, like there is some neuromuscular inhibition, like the neuromuscular transmission is inhibited in all these cases.
Very specific, common and specific.
So channelopathy, they are affecting the channels somehow, like acetylcholine channel, and this is affecting calcium.
Neuromuscular junction, you can maybe specify what type. I cannot
I'm not sure. I don't understand.
Okay. So okay, I won't give it to you. That was a very broad thing. You are very close. I was thinking of telling you what is the type of neuromuscular blockade here. So okay, that's fine. That was a very, these things happens in quiz, but you were very good with all the answers. So the final connect they are all targeting the presynaptic terminal in a synapse or nerve terminal in a neuromuscular junction. So that is very important. Lambert-Eaton targets the calcium channels in the presynaptic and causes increased release, and that's why there is repetitive nerve stimulation increase. So, and in Create Bite, it is presynaptic. So neostigmine won't be of any use. And the first question also, Botox also affects the presynaptic terminals. So I think this was a very good connect, and he was almost there. So far, so close yet so far. So the next person, Radha, are you there?
Yes, sir.
So which one you want to choose? Wilson is done, Chase is done, House is done. The first 3 are done.
Sir, the second one in the next row.
So you will go with this one, right?
Yes, sir.
Okay. So you have set 3. So I'll read out this. There are 4 images and you have to connect and explain. And your time starts now.
Yes, sir. The first one is some goblin something.
Okay.
So the next one is cloudy cornea.
Then the third and fourth?
Third one is probably mental retardation or something.
Yes. And the fourth one?
Then there is fourth one is open anterior fontanelle.
Not just that.
Maybe.
Not just that. There is a specific finding which is very important for the connect.
Time is up.
So you want to guess the connect?
So some congenital disease.
So what is it? You have to tell me. No, you have to specify. You have to specify. I can. Your voice is breaking. Answer. I need a. No negative. No negative. Just answer. A specific.
Sir, is it Hurler syndrome?
Right. You are correct. You are correct. I'll give it to you.
Sir, is it Hurler syndrome?
You are correct. I'll give it to you. You get 5 points and you get 2.5 here because you answered this two things correctly. The cloudy cornea and the mental retardation symbol. And the first image is actually gargoyle, which is being shown. That is gargoyle-like facies. And this is basically showing this characteristic J-shaped cella, which is there in dysostosis multiplex, characteristic of the mucopolysaccharidosis. So if you connect all these four, then you get Hurler syndrome as the final diagnosis. So Radha gets 7.5 points here. So shall we move on to the second question?
Yes, sir.
So I'll read out the question. You see, read the question with me. 70-year-old female came with a history of easy fatigability and dizziness. There is no history of recurrent mouth infection, fever, bony pain, bleeding manifestations, or reduced urine output. There is no significant past history of family and or drug history. On examination, pallor is present significantly, no cyanosis, clubbing, lymphadenopathy, edema, icterus. Vitals are stable. All systemic examination are normal. CBC is showing you an HB of 6.6, WBC of 1700, a DLC of N34, lymphocytes 52 and monocytes 13, and platelet 89,000. So these are the 4 peripheral smear findings. Peripheral smear actually is the first one, and the next 3 are the bone marrow biopsy findings. First and third is peripheral smear, and this second and fourth is bone marrow biopsy. So anything ringing in your mind, and your time of 30 seconds will start now.
Cells is seen in the first image, and stomatocytes is also seen.
So okay, I'll give you 15 more seconds.
Third, I can see bilobe.
Yes, you can tell me the diagnosis right now and further investigation for the disease. I'll give you 30 seconds from here.
Can you please move to the previous slide?
Hello, yeah.
Time is up. There is bilobe nuclei in
The time is up. Any final diagnosis you want to say? Any final diagnosis, Radha?
There is bicytopenia, and because there is anemia and reduced WBC.
So what is your
suggesting some bone marrow infiltration?
No, I would not go ahead with bone marrow infiltration as a final diagnosis. You don't get any point here. So I was very specific with my history here. There is no significant past or family and drug history, no other symptoms, mind you. And there is only pallor, and you are seeing not bicytopenia. This is pancytopenia here. So pancytopenia, you are having pallor and no systemic examination. So hepatosplenomegaly will go against bone marrow infiltration. So it is more of a hypoproliferative condition. So the final diagnosis will be here MDS, myelodysplastic syndrome, trilineage dysplasia, and mutation analysis is the gold standard investigation. Specifically, you want to look for 5q deletion because lenalidomide is quite effective, right? So you don't get any point here. So shall we move on to the third question?
Yes, sir.
Okay. This is again a connect. There are 4 images and your time starts now.
Sir, in the last image, there is flask-shaped femur, or flask deformity.
Right. Next.
Then there is this rugger jersey spine in the third image.
Okay. Second.
Then
Some cross section of something being shown.
Sir, I think superior vestibular and inferior vestibular nucleus is at the
What is the cross section?
internal acoustic meters.
Yes, yes. And the fourth image and connect, please.
Sir, first image is some
Sir, the time is up.
You want to try for a final connect, the final diagnosis of all these 4 images?
Sir, is it?
It's a classic quiz question. Can you give the answer?
Sir, is it osteopetrosis?
Right, I'll give you 5 points here. And for the this thing, you will get 2.5 each. For this is actually internal acoustic meters, and you correctly identify the nerves here. And this is Erlenmeyer flask deformity indeed. But here the image is showing dactylocytes, which is suggestive of again myelophysis. And the third image is again showing endobone appearance, right? So there you go. That is osteopetrosis. She gets 7.5 point marks for us. So you have 3 diagnoses: Hurler, osteopetrosis, and myelodysplastic syndrome. So you want to go ahead with the final question before or after the slide?
Sir, I want to see the slide.
Okay, okay. So this is the question, and your time of 15 seconds will start now. Definitive therapy for all these 3 conditions commonly.
Time is up.
Okay, okay. Okay, okay. Anyone wants to try?
So enzyme, like gene therapy enzyme.
Bone marrow.
No. That is, yes, he was correct. Vicky was correct. Come again, Vicky.
Yes, bone marrow transplant replacement.
Right. Bone marrow transplantation. If she would have said this, I would have given her maybe half the points, 10 points maybe. But she did not say even that bone marrow transplant also. So it's allogenic hematopoietic stem cell transplant, right? So you have to take it from some other donor here. So we'll move on. Who is the 5th person?
Soumitra, sir.
Okay, Soumitra.
Yes, sir.
Cardi and Foreman.
Sir, last Foreman.
Okay. Okay, you have the last set here. All the best. Here goes your first question. You have 4 connect images. And your time starts now.
The first is dexamethasone, that is steroids. Most probably means treatment option over. Second, third is some acid poisoning, maybe any carbolic acid or oxalic acid.
Second. Third.
The third is maybe hemophagocytosis.
No. That is a very easy. Should not be
Time
this.
is up.
Final connect. You want to try?
Sir, the time is up.
Sir, AML M3 faggot. I think the faggot cells.
You want to connect? You want to give that connect?
AML, yeah, acute myeloid leukemia.
Okay. So I'll give you 1.25 points just for dexamethasone because you did not say the third image. The third image was actually AML M3. If you would have said that, you would have got 1.25. But you said the final connect is AML M3, which is not so. So the first image is actually showing dexamethasone, which is first-line treatment for this condition. The second is showing bat wing infiltrates, midfield pulmonary infiltrates, which is characteristic of this disease. And here you are being shown faggot cells, and the last image is of all trans retinoic acid. So if you would have guessed 3 images correctly, you would have got the 4th image correctly. Right. So the final diagnosis is differentiation syndrome. So keep this in mind, differentiation syndrome. Right.
Yes.
So shall we move on to the second question?
Yes, sir.
Okay, fine. So you have 4 images here, and you have to connect and explain Your time starts now.
Second is sir FFP, fresh frozen plasma.
Right.
Okay. Third is that centrifuge tube, or that means centrifugation.
Right. So is it FFP or something else?
That first is sir Aedes mosquito. That
right. Third?
And third is this rash, some erythematous rash patchy distribution throughout the body.
Final connect. You're close. Easy, not so hard.
Time is up.
Sir, dengue means.
Dengue. So you want to?
Yes, sir,
I'll give you 5 seconds for the third image. Anything specific to dengue?
Dengue hemorrhagic syndrome or rash.
No. So you get 7.5 points here. You correctly identified Aedes. You correctly identified the hematocrit centrifuge, which was very good, but it was platelet. It is not FFP. So it is simple platelets. FFPs will be a bit more thicker and more bit orange. And this is that characteristic rash in dengue, right? Which goes by this white islands in a sea of red. It is seen in recovery. So the final is dengue fever. So keep this in mind. Dengue fever and differentiation syndrome. A common link is there. So I'll move on to question 3.
Yes, sir.
Okay. I'll read with you. You also see the question simultaneously. 30-year-old female, known case of PCOS and infertility, is trying for ovulation induction with HMG. She received an HCG trigger and an artificial insemination was done. After 18 days, she presented with abdominal pain, distension, breathlessness, nausea, and vomiting. There is no history of reduced urine output, loss of consciousness, altered sensorium. On examination, temperature was afebrile. BP was a bit on the like not low, but on the lower side. Heart rate was increased and respiratory rate was 25. So per abdomen, you notice shifting dullness is present. RS, you hear reduced breath sounds over both lung bases and dullness is present. On blood, on the investigations, blood urea and serum creat is kind of elevated. You can see the sodium is 143, potassium is 4, chloride normal, and calcium 9.6. So these electrolytes are normal. And you see some LFT findings here.
Yes.
Shall I move on to the next slide? So CBC is showing you a kind of anemia. Platelets are 4 lakhs. TLC is increased and PCV is increased. Note that. So the pelvic USG is showing some very characteristic findings, and USG abdomen and chest is showing ascites and pleural effusion. I think you would have got the diagnosis by now, but that is not my question. So how could this condition have been prevented? Mutation in which receptor can cause this syndrome without exogenous hormone? The question is totally up to you. Please ignore the other team's part. So your 30 seconds will start now.
Sir, prevention is one to delay the injection that menopausal gonadotrophy, because it is ovarian hyperstimulation syndrome.
Okay.
So and which receptor?
Second question, or another way you can prevent. There are 3 to 4 ways.
Sir, we delay the beta HCG injection also, and we prevent that. Yeah.
Right, that is one. And the other?
Sir, the time is up.
You want to try the mutation?
Sir, FSH receptor mutation.
Great. That's what I wanted. So you get 7.5 points here. So the 7.5 points, you could have delayed injection, and then you could have cryopreserved the embryo. Then you could have used cabergoline along with injection HCG, or you could have used progesterone as luteal phase support instead of HCG. These are the possible ways you could have prevented OHSS, and FHS receptor is actually associated with gain of function mutation.
Sir, why 7? Like I answered all 3, right?
You answered delaying injection HCG and stopping gonadotropin.
Okay, so that is it.
Okay. So you could have said maybe cabergoline or using progesterone or cryopreserving the embryo, which is the most basic thing to do. So, okay, you get 7.5 points. So you have 3 diagnoses in mind. Do you want to try the question early?
Could you repeat the diagnosis? Just 1 minute. Dengue was then?
Dengue and differentiation syndrome. So you want to try it? The thing or you want to see this?
Is it? Can I tell the pathogenesis also if I feel that's the connect?
Okay, you can say that if you want.
So I think, sir, they are all related to capillary leaks. Like dengue is.
That is excellent. That is excellent. This is the first person who has answered that in total 3. Like before the final slide is being shown, and yes, this is the severe manifestations are because of one thing, that is systemic capillary leak syndrome, and that is a fantastic answer. And Soumitra will get 40 points here. So congratulations. This is a wonderful connect. I did not actually, this was one of the tough ones. I did not think one will answer this. So shall we move on to Aryan? Aryan, are you there?
Yes, sir.
Okay. So you have Kadi left here, this one. So we'll go ahead. So are you ready? Shall we show the first question?
Yes, sir. Yes, sir.
So there are 4 images and you have to connect. Your time starts now.
So first image showing erythema marginatum, and fourth image is showing slab cheek appearance in the baby, maybe parvovirus infection.
So why this image? Second image.
Second is maybe it is wrist drop or any nerve, radial nerve palsy.
So you see something on the left shoulder, you see something in the eyes and cheek also, just not the cheek, you see in the eyes also. You see a finding in the skin.
This is third is pustules, maybe. No, sorry, or rash, erythema.
You want to go ahead with a connect?
The time is up.
Sir, parvovirus B19 infection, maybe.
No. Why this was to confuse you, because this thing is showing the hands. That is where connect beauty comes. You have to see all the 4 images. This is erythema and edema of the hands here. This is the left shoulder BCG scar is being reactivated. And fourth image is a polymorphous rash. And the third image is a bilateral conjunctivitis, which is non-purulent. So now I think the diagnosis will ring to you. It's Kawasaki's disease. So you don't get a point here. So keep the diagnosis in mind here. So we are moving on to the second question. So you read with me. You will get only 30 seconds after I read. 20-year-old unmarried female with no prior medical history presented with the hospital with history of worsening fatigue, dyspnea on exertion, palpitations of over 1 month. The patient reported difficulty climbing more than 1 flight of stairs due to shortness of breath. She also noted heavy menstrual bleeding and thinning of hair over the vertex. So very classical symptoms. She denied any history of anemia, easy bruising, bleeding, yellowing of skin, rashes or prior blood transfusion. Review of systems was positive for fever several weeks before presentation. So she has some fever for a long duration, but otherwise other symptoms are negative. The patient is not on any medications and has no prior surgeries and had no allergies. The patient denied any alcohol, tobacco or illicit substances. On physical examination, you see the BP is normal, heart rate is elevated, respiratory rate was normal, temperature was normal here, and BMI was a bit on the more side. The patient was alert, oriented, and in no acute distress. 5 small hard palatal ulcers were noted on oral cavity examination, and non-scaling alopecia was noted. Pallor was noted. The patient had multiple lymph nodes of varying size, non-tender in anterior and posterior cervical chains and submandibular and supraclavicular regions. No icterus, cyanosis, clubbing, edema. Rest of the clinical examination was insignificant. So lab data is showing you hemoglobin which is reduced, hematocrit of 14.1, red cell distribution, red cell count which is again on the lower side, platelet count was normal, and white blood cell count is again normal, and reticulocyte count is only 0.1. So LDH was elevated to 235, LT, AST and ALP are normal, ESR is high, see here, and CRP is normal, and ferritin is also elevated. So the patient was admitted to the inpatient ward where she was transfused with 3 units of packed cells and hemoglobin increased. A peripheral smear then showed poikilocytosis, microcytosis, and thrombocytosis. Bone marrow aspiration failed due to dry tap. Mind this, dry tap. And bone marrow showed significant for moderately increased reticulin fibrosis and mildly increased megakaryocytes in the marrow. So the patient's clinical symptoms improved and some special investigations were done to clinch the underlying diagnosis. So what is the diagnosis and what are these investigations? Some very classical findings were shown, and I gave you the bone marrow also. So
Sir, is it primary myelofibrosis?
Due to just myelofibrosis?
Sir, it is showing dry tap in the bone, fibrosis, and teardrop cells.
Other symptoms were also there. She had other symptoms also.
So it is showing thrombocytosis also and heart failure, I guess, from the polycythemia.
Did you find polycythemia or anemia?
No, sorry. Anemia. Sorry. Heart failure due to anemia, maybe.
And ESRD is raised. Ferritin is raised. She had ulcers and alopecia.
Sir, is it glycoglobin gene mutation? Oh,
No. I'll give, and you want to guess the investigations?
Sir.
Okay. You were very close. You just missed the pointers in the history. That is how clinical VNets go. So the diagnosis is autoimmune myelofibrosis due to systemic lupus erythematosus. I gave you enough clues to diagnose SLE first. And the investigations is anti-dsDNA, anti-Smith DNA, anti-ANA, which will actually rule in SLE. So this, you will get 2.5. You answered myelofibrosis. That is the least I can do for you. 2.5 points you get here. So keep that in mind.
Okay.
SLE.
Okay, sir. Okay.
So now you read the thing. This will be brief. I'll hint you. A 36-year-old asymptomatic female presented with routine lab reports done as a part of multi-test packaging showing deranged values. FBS was showing some increased values. PPBG was again showing abnormally. TSH was again 15. FT3 and FT4 again was on the normal side. Blood urea and serum creatinine was normal. Sodium, potassium, calcium and magnesium are values shown here. They are mostly normal. Uric acid is elevated, as you can see, and ALT, AST, ALP may be on the higher side for a female, but we'll consider that normal. And the cholesterol is shown as follows. So what is the diagnosis that will first come to your mind? An asymptomatic female coming to you like this. So quite a features are there. The thyroid findings, the blood glucose findings, the lipid findings, the uric acid findings, very common. It is a cluster of something.
Is it autoimmune polyendocrinopathy syndrome? Maybe.
Why do you think that is a polyendocrinopathy? Why hyperlipidemia? It is an asymptomatic patient and blood glucose is elevated. Just elevated, mildly elevated. So should it be, I don't think it's type 1, asymptomatic female. You want to try the diagnosis?
So maybe fatty liver pregnancy or something.
Pregnancy, it's asymptomatic.
So I don't know.
Yeah. So I'll go on. It was a bit easy and also a bit tricky. It is metabolic syndrome. You cannot miss metabolic syndrome. Your relatives will come with certain lab reports and you have to diagnose metabolic syndrome from the lab reports only. They won't give you any symptoms. This is a very common scenario. Very common scenario. Your co-worker nurse might come and show you this lab findings which she had done. So, and it actually happened to me in internship. So one of the DRL ammas who were working there showed me the reports and asked me what to do. Her thyroid was elevated and she did not go to a professor first. That is the good thing about these things. And you can counsel them regarding metabolic syndrome and the management, which is very easy. It is weight loss, calorie restriction, exercise, a low-fat diet with no refined or sugar intake, and increased fiber and omega-3 fatty acids. And for subclinical hypothyroidism, you can repeat TSH after 3 months, or you can start levothyroxine directly if the TSH levels are normal. So there are 3 things: metabolic syndrome, SLE, and Kawasaki's disease. You want to go for the connect or you want to go for the slide?
So next slide, please.
Okay. So you will get 15 seconds for the connect and your time starts now.
Morbidity and mortality in those conditions. Maybe cause heart failure.
Sir, cardiovascular anomaly, cardiovascular problems like heart attack or something like that.
Right. I'll give it to you. I'll give it to you. I'll give you were not that specific, but I'll give maybe 15 points to you here. So that was very good. I'll give 15 points. Scorers, please note. This is accelerated atherosclerosis as it is called, and premature cardiovascular disease. So you have to be very specific in these questions.
Okay, sir. Okay, sir.
Because you are the cream, you have to be very specific in these things. And people have answered very specifically in the connects. Try to answer them very specifically. So that is premature coronary artery disease or accelerated atherosclerosis that is there. So here I'll end my round. So it was quite an exhaustive round, but I think it was very useful for all of you. A different kind of take on quizzing.
So I think, it was a very informative round, and Anirban, I should say that, the amount of effort you have put in for this rounds, it's amazing. And I think it really tested their knowledge, just like in cricket, you have a test match. So this round was a real test of knowledge. So can we quickly, since already it is 11:27, so we'll just quickly go to the scores. So Nadir, can you just let us know the scores quickly?
Sir, since the first round?
Yeah. No, the total score now. Total score.
So I think they will take some time for the.
Okay. Do you want more time?
You can go ahead with the other rounds you have, sir.
Sir, the scores are participant number 1, Soumitra, 86.25. Participant number 2, Akash, 75. Participant number 3, Aryan, 42.5. Participant number 4, Vicky, 55. Participant number 5, Devang, 46.25. And participant number 6, Radha Agarwal, 50 points.
All right. So Dr. Soumitra leading now. Good lead there. So let's quickly move on to the next round. So next round, I'll be just doing it. And yes. Okay. Are you able to see my screen? Yes.
Yes, sir.
Yes. So let's go to the next round. So next round is about certain scenarios in common clinical practice. Okay. That is a common theme. And you have to say the answer to the question that I'm asking you based on certain scenarios in routine practice. So first, Soumitra, hope you are ready. And
Yes,
here is the question. Hey, Soumitra, what is the drug of choice or the gold standard drug in idiopathic Parkinson's disease?
sir, levodopa and carbidopa combination.
Okay, levodopa, carbidopa. So that's not the question. The question is this. A 60-year-old male is diagnosed to have idiopathic Parkinson's disease. He started a levodopa, carbidopa combination. What are the advices you will give the patient on taking the drug? You have to give certain advices to the patient. And what are they? Quickly, you get 30 seconds.
One is to we don't ask them to chew or tablet. We just ask them to take it whole. Another is we avoid that high protein diet because vitamin B6 can interfere with the absorption. Other, sir, like what specific means?
Yeah, just like that, when you take a tablet, what time of the day, how often should you take, like that.
Okay.
Again, what to avoid. You said one valid point. I agree about the high protein diet. Agree. Please go on.
Then, sir, they also can cause like nausea, vomiting. So they are usually advised to take with food, taken with food, and they are started once at a night time dose.
So the time is up.
Yeah. So actually, except for one point, the remaining points are wrong. In fact, they are actually wrong answers. In the sense, see, when you prescribe levodopa, carbidopa, here are the points you should take care of. Number one, see, you have to take the tablet on empty stomach. That is point number one. It should not be near food. So, and you should be taking the first tablet in the morning. The time you wake up and you start your mobility, you should be taking tablet because you have to have your dopamine levels. So it should be taken on an empty stomach. So suppose if I wake up at 6:30 and I have my mobility from 7 o'clock, you have to take the tablet early, maybe 6:30, 6:45, empty stomach. At least a gap should be 1 hour gap should be there before I take my breakfast. So suppose if I take the morning dose at 7 o'clock, the next dose should be at 11 o'clock. There should be a 4-hour gap. Okay. And again, the third dose, because I'm saying third dose because usually it is taken 3 times a day. And third dose is not at night. It's again at say 3 p.m. or 4 p.m. Because you said, it can be taken at night. Again, that is wrong. See, what is the requirement of taking dopamine at night? You are not moving, no, you're going to sleep. There is only one indication where you give levodopa at night. That is when, the patient is having a significant REM sleep behavior disorder. So next point, as you rightly said, avoid protein, correct? You have to avoid protein because that will interfere with the absorption. Next is you have to avoid milk also because if at all you want to take milk, take towards night time, you're not having the dose of levodopa. These are the points you have to take into consideration. Once again, empty stomach and 4-hour gap between the tablets. And, it should not be, avoid proteins and avoid milk. And it's usually taken at an initial dose of half tablets. And if there is any nausea, vomiting, definitely come back and report to me. You have to say that because there is a chance that levodopa can induce nausea, vomiting, and you have got to increase the dose of carbidopa. These are the important points that you have got. Anirban, there is some noise from your side. Can you please mute? Yeah. All right. So these are the points, but I'll give you say 2.5 points because you said 1 point out of that. So scorer, please take note. I'm giving Soumitra 2.5. See, I specifically put this question because in practice, I think along with knowing about the drug, certain common advices. And see, I have not brought in a scenario which is rare or rare disease, nothing like that, a common disease only. I think we should all know this. Okay. Candidate number 2, Akash Sethi, are you ready?
Yes, sir, I am ready.
This is your question. Your question is this, a 50-year-old male weighing 70 kg has a sodium deficit of 120, has a sodium level. It's not a sodium deficit, sodium level of 120 milliequivalent per liter. Pardon the spelling error there. Calculate the sodium deficit. Yeah.
Yes, sir, I'm on it.
Yeah. You can quickly calculate the sodium deficit and tell me in 45 seconds.
Sir, I'm not sure, but is it 60 milliequivalents?
60. Wrong answer. It's not 60 milliequivalents. So first of all, the formula for correction is, this is, if you remember, Anirban also will be knowing this is actually a question which was asked in the NEET PG exam as well. Okay, so the formula is sodium deficit is total body water percentage into weight and multiplied by the difference between the desired sodium and the actual sodium. So for the total body water percentage, it is 0.6 for men. And here it is actually a male that is given in question. So it is 0.6 into the weight in kilograms 70 desired sodium. So suppose if it is 136 to 145. Let's put it on an average 140. So 140 minus 120, which is 20. So the total comes to around 840 milliequivalents. And this was the exact option that was given in the NEET PG examination. Okay. All right. Let's move to the next candidate. Aryan, are you ready? Okay. Aryan?
Yes, sir. Yes, sir. Yes, sir.
So Aryan, this is your question. A psychiatric patient was prescribed on tab risperidone 2.5 milligram to be taken daily. Next day, the patient presented to the emergency department with persistent upward deviation of both eyeballs for the past several hours. What is your diagnosis and how will you treat? Again, question which was asked for the Central Institute. Yeah.
Sir, is this side effect of antipsychotics like acute muscular dystonia? Treated with the central anticholinergic drugs, maybe.
Fantastic. So, first of all, appreciate. Once again, please tell me what is
acute muscular dystonia.
Yeah, it is an acute dystonic reaction.
Sir, I'm audible.
Yes, you are audible. You are audible. Yes. Yeah. So it is an acute dystonic reaction. What do you call this sort of an acute dystonic reaction? Do you know the name? I'll give it to you.
Sorry, sir, I was not able to hear you. Can you please repeat it?
Yeah, as you rightly said, it is an acute dystonic reaction. But what do you call the acute dystonic reaction?
Sir, acute muscular dystonia.
So it is also, yeah, it is right. It is an acute dystonia. What is the other name? It is also known as oculogyric crisis. Oculogyric crisis.
Yeah, yes, sir. Yes, sir. Yes, sir. Yes, sir. Yes, sir. Hello.
What is the treatment?
Hello. Sir, central anticholinergic drugs like benzahexol.
Yes, absolutely right. Anticholinergics, they are used in the treatment. So 10 points for Dr. Aryan. So 10 points for Aryan. Scorer, I hope you are taking note. Okay. Next, Vicky, here is your question. So Vicky, it's a question for you. The following is the ABG result of a patient with myasthenia gravis. pH is 7.32. PaCO2 is 60 millimeter mercury. And bicarbonate is 32. I want the exact answer, the exact full answer. What acid-base disorder is the patient having?
So it's a case of respiratory acidosis with compensation, complete compensation, sir.
Pardon? Can you please repeat?
It's a case of respiratory acidosis.
Okay.
Compensated, sir. Chronic, sir. Compensated it is.
Absolutely right. So it is a chronic composite. It is an acidosis, first of all. 7.32 acidosis is there. And if you watch my lectures also, I have given you a simple way of approaching the acid-base disorders. So this is an acidosis. And as you can see, the pH is going down. PaCO2 is increasing, bicarbonate is increasing. So both of them are going in the opposite direction of pH. So it is a chronic it is a respiratory acidosis, and myasthenia gravis is a chronic condition. So you can say it is a chronic respiratory acidosis. Looking at the compensation, the PaCO2 has increased by 20. So for each 10 mm increase, there should be 4 milliequivalent rise. So you can see there is 60 mm. So 20 mm increase is there. So 8 milliequivalent should be the increase in bicarbonate. Yes, the average bicarbonate is 24. You add 8, it is 32. So it is a chronic compensated respiratory acidosis. So it's a chronic respiratory acidosis with a compensatory metabolic alkalosis, or in simple words, you can say it is a chronic compensated respiratory acidosis, and Vicky gets full 10 points. Next candidate, Devang. Get ready.
Yes, sir. Yes, sir.
Yes?
Yes, sir. I'm ready.
Yeah. Devang, here is your question. A simple question, a case scenario in your OP. You just have to find out what is the axis here. In this ECG, what is the axis? Just find out the axis and tell me. You've got 30 seconds max.
So is this rightward axis? The patient having rightward?
Wrong answer. Anyone else? What is it?
Determinate axis.
It is an extreme axis. Okay, this is the whenever you have a ECG, what is the ECG diagnosis? You have got a VTAC. And in VTAC, you know, if you look at the R minus S in 1, it is negative. R minus S in AVF, it is negative. Negative, negative, it goes to extreme axis deviation. So this is falling under extreme axis deviation. Okay, extreme axis deviation. I mean, I think, you know, the same ECG I've shown in my lectures as well. And I've explained also how it is an extreme axis. Okay, so next candidate, Radha, are you ready? Radha? Hello? Radha Agarwal? Radha, you're muted. You're muted, Radha.
Yes, sir.
Yeah. So Radha, here is a question for you. Now, this is a scenario of a patient who is in the neurocritical ICU. And what I'm going to show you is a method for assessment of the consciousness level in a patient in the neurocritical care. What is the diagnosis? What is the scoring system?
Sir, the eye movements are being checked, muscle response is being checked.
What do you call this? What do you call this? In a neurocritical ICU, what do you call this? What scoring system is this? Your time is up. So this is, in fact, any comments? Okay, Vicky, you want to go?
So this is 4 score.
Absolutely right. So it is the 4 score. Radha, can you mute? Can you mute, please? Yeah. So this is the 4 score. That is the full outline of unresponsiveness, which is having one advantage over the GCS, conventional Glasgow Coma scale. Can someone tell me what is the advantage? Okay, the GCS score does not take into account
intubation patients.
One is, it does not like intubated patients also. It does not interfere with the assessment, as you rightly said. That is one point. Number 2 is that brainstem reflexes are also taken into account here, and we know that in GCS it is not taken into account. So that is also one advantage of the 4 score. Okay, so that ends this round, and I'll finish my next round, and then we'll have the combined scores. Okay, and after that we'll have 2 quick rounds from Anirban as well. So Anirban, you get your questions ready. I'll just finish my last one. So last one round is on staying updated. Now this is something I always tell medical students that, see, when you learn for your PG entrance, it's not just about cramming data from your notes. You have to stay updated with what is latest in medicine. That is very important. You cannot just study, say, some old notes, some literature that is many years back, because you have to always stay updated. That's very important. So this is about staying updated and about the recent advances. That is this round. So Soumitra, I hope you're ready. And scorers,
yes,
also keep an eye. This is our next round. We'll be having 6 questions. And yes, Soumitra, here is your first question. So this question will have 2 parts. Okay. And listen to this carefully. This is again an FDA press release that came this year in 2022. This is the FDA press release. FDA approves first drug that can delay the onset of type 1 diabetes. And this is the statement by the Director of Division of Diabetes and Lipid Disorders in the FDA. So he says this is today's approval of a first-in-class therapy as a new treatment options for certain at-risk patients. The drug's potential to delay the clinical diagnosis of type 1 diabetes will provide patients with months to years without the burden of the disease. Now, my question is, what drug are we talking about? Question number 2 is, what is the mechanism of action?
So the drug is teplizumab, and it's a monoclonal antibody to CD3.
Fantastic. Fantastic. Absolutely fantastic, Soumitra. Very good answer. It is teplizumab, the drug, and the mechanism of action is it targets the CD3, and which, as you can see in figure, is involved, in reducing the damage to the beta cells, which are mediated by the effector T cells. Very good, Soumitra. Next is Dr. Akash. I hope you're ready. Here
yes, sir, ready.
Question, Akash. Akash, 20.
Sir, Soumitra's score
Tomitra gets 10 points for that. 10 points. 10 points for that. Okay. 5 plus 5, 10. Yes, Nadir, are you clear with that? Yes,
sir.
Yes. So, Akash, your question is, in 2021, the guideline of the American Heart Association and the American College of Cardiology came on the evaluation and diagnosis of chest pain, and they put forward certain very good points of suggestions and recommendations. So my question is based on this update in 2021. The question is, they made, in that guideline, they're saying about 10 important take-home messages. And I'm talking about 2 important messages in that. So one message was regarding atypical chest pain. If you know, in common clinical practice, many a times, you might write in the case sheet, atypical chest pain. So they made a comment about atypical chest pain. And second, they made a comment about the use of the term anginal equivalence. I want to know what is the current state on the use of these 2 terms. Number 1, atypical chest pain, you will get 5 points, and anginal equivalent 5 points. Yes, please.
Sir, the angina equivalent could be seen in patients who do not give the typical presentation. It would be sweating, syncope, those kinds of presentation, and atypical chest pain would be epigastric pain.
I'm asking you, my question is specific. What comment was made on the term anginal equivalent?
Sir, it's seen in those cases where the patient does not come with the symptoms of chest pain. So we have to consider those symptoms as an equivalent to angina.
Okay, good. I'll give you that. Atypical chest pain?
Sir, atypical chest pain would include probably right-sided chest pain or epigastric pain.
Okay, any comment on that?
Sir, chest pain related to the right arm or to the right side of the body.
It's a wrong answer. So see, the first point, the non-cardiac chest pain, which is the atypical chest pain, the guideline says do not use the term atypical chest pain. So now we are not supposed to write atypical chest pain in the OPD sheets or the ward sheets. You have got to write non-cardiac chest pain. So atypical is out and non-cardiac is in. That is one take-home message. And these take-home messages are the official take-home messages of the American College of Cardiology and American Heart Association. And the second point, I agree with you. Anginal equivalents are important and still holds, a very important place, because they say that chest pain means more than pain in chest. So don't think that all cases of an acute coronary syndrome will present with an acute chest pain, because other symptoms like pressure, tightness, discomfort in the chest, shoulder, arms, back, and as you rightly said, certain maybe pre-syncopal episodes, these can present with anginal equivalent symptoms as well. Okay. All right. So you get 5 points. Scorer, please take note. He gets 5 points. Next, I think it is Aryan, right? Next is Aryan.
Yes. Yes, sir. Yes, sir.
Yes. Aryan, here is your question. Aryan, we had the updated stroke guidelines in 2019. Okay. After 2018, we had the updation in 2019. So in 2019, I want to ask you 2 questions based on the updated guidelines. What change was made in the time window for mechanical thrombectomy is my first question. And second is, what are the landmark trials that led to the change? That is what I want to know. Yes. First question, change in the time window for mechanical thrombectomy as per the latest guidelines. Yes.
So the present time I know is 4.5 hours, sir.
Okay.
Hello. I'm audible, sir?
Is that your answer? 4.5
yes,
hours?
Sir. Yeah, 4.5, sir. 4.5 present time. 4.5 hours. Sir.
Mechanical thrombectomy.
And then the landmark trials.
All right. What are the landmark trials?
Sir,
okay.
All right. I don't know, sir. That.
Anyone else? Anyone wants to take a guess?
Sir, it's 24 hours for mechanical thrombectomy.
Fantastic. Yes.
That was probably
Which trial, rather?
Sir, MUSC trial was it?
Pardon?
MUST, sir.
No, not MUST trial. So the first thing is the change in the time window for mechanical thrombectomy. Well, I think, the candidate Aryan, I think you were speaking about thrombolysis. Remember, this is mechanical thrombectomy.
Yes, sir. Yes.
Mechanical thrombectomy, previously it was 6 hours. Even now it is 6 hours, but you can extend it up to 24 hours. So in the 6 to 24 hours, can you do in all patients? No. The patients with a proximal large vessel occlusion, and if the hospital has a facility for CT perfusion or MR perfusion, and when you do that, if you are able to demonstrate an ischemic penumbra, that is a salvageable ischemic penumbra, then even in the extended time window of 6 to 24, you can consider doing a mechanical thrombectomy. So 6 to 24 also you can consider in certain scenarios. That is a change in the time window. Landmark trials, the Dawn trial and the Diffuse 3 trial. Very important. I have highlighted this in my lectures as well. I usually for NEET PG, I don't highlight trials, but this is one trial, I have highlighted because it is very, very important. The Dawn trial and the Diffuse 3 trial. Okay. The Dawn trial and the Diffuse 3 trial. Candidate number 4, Vicky, are you ready?
Yes, sir, ready.
So no marks here for this, in this question for Aryan. Vicky, here is your question. Vicky, just a week back, we had the hardly 6 days back, we had the release of the guidelines by the American Diabetes Association. So did you have a chance to go through that, Vicky?
Sir, no, sir. I'll have to guess, sir.
Okay, but unfortunately, I had the time, so I'll be asking you a couple of questions on that. So the question is this: 2 questions on this. Let's see, how good is your guessing. The new guidelines for American Diabetes Association, because even in my lectures in the app, I've done the 2021. Now I'll have to reshoot according to the new guidelines. So the threshold BP for treating hypertension in diabetic patients, what is it? It's my first question. My second question, yeah, we'll take the first question and then we'll go. Vicky, first question.
Sir, I have to guess, sir, here. So is it the cutoff for the after the treatment, sir?
See, either way, it is the same answer. So even means, in a diabetic patient, he is detected to have hypertensive. What is the threshold where the medicine should be started? And, even otherwise, that is also right. Is the other is also the same value. Yeah, what is the answer?
So 130, sir.
Pardon?
130 by 80, sir.
130, 80. Right?
Yes.
Okay, and you say that you have not gone through the guidelines. You're too good in guessing. You're too good in guessing. Absolutely right.
So actually, this data I read somewhere in some nephrology textbook, sir.
Okay, all right. So but the guideline actually came 1 week back, and it was actually revised, this cutoff. So it is 130/80 is right. You get 5 points for that. So let me ask you the second question. For diabetic patients aged 40 to 75 years without atherosclerotic cardiovascular disease, what is the recommendation on use of statins? Should we not? And if at all we have to give, what dose? If we are not giving, why?
So we should give statin, sir.
Okay. And what is the recommendation?
Sir, sir, I guess it's the target LDL is, I guess, around 130 above, sir. Around, I vaguely I remember something somewhere I did.
What dose you have to give the statins, if at all you want to give?
So half the normal dose, sir.
Pardon?
Half the normal dose, sir. Like rosuvastatin.
What is the normal dose?
So for rosuvastatin, I guess it's 20 to 40, and atorva, I guess 40 to 80. So half of it, I guess.
Which means you have got to give how much?
Sir, like rosuva 10 to 20 and atorva 20 to 40. So just a guess, sir. Wild guess, sir.
But that best guess almost got you right, but just you fell short. But see, you're right. Statin should be given. That is point number 1. Point number 2, they are given at not a high dose, but it's a moderate intensity statin. So when I say moderate intensity statin, this is again the screenshot from the guidelines. It's atorvastatin 10 to 20. This is moderate. This is high intensity. Here in this case, you have got to give moderate intensity. So that is around 10 to 20 milligrams. Okay, so moderate intensity statin therapy is recommended. So you get full 5 marks for the first one, and the second one you get only half. You get 2.5. So Vicky gets 7.5 points for this. 7.5 points. Okay. All right. And shall we move on to the next question? Yes.
Yes,
So
sir.
Devang, I hope you're ready. Devang,
Yes,
here is your question. So this again a 2022 press release by the FDA. FDA approves new treatment option for patients with ALS. And yeah, what is that drug? Just say the drug. You get 10 points.
So I'm not. So it like had some weird name. Like I'm not sure. I just read it somewhere. Relivrox or something. I'm not sure. So was it like Relivrox or Relivrox or Relivru, I guess.
What is the chemical name?
So chemical name, I'm not sure. So like I'm sure it was like the name was this one, sir.
Okay, so you have got to say the chemical name. You're near that. So, but unfortunately, since you're not able to give the chemical name, I am not able to give you points. The correct answer is a co-formulation of sodium phenyl butyrate and taurosdiol. So that is a co-formulation combination. So what you were trying to say is the trade name part, but this is a co-formulation, and this is the one that has been FDA approved this year. Okay, this year. The final question of this round to Radha. I hope you're ready, Radha. Yes. So Radha, are you ready?
Yes, sir.
Radha, identify the device and what is its use.
Sir, it is used for left atrial appendage thrombus.
Left atrial appendage thrombus.
Prevention means.
Okay. What is correct? That is the use is right. And what is the name of the device?
Sir, something like guard it was. I don't remember.
Got it.
Some means the name was also something related to protecting only.
Yeah, you're right. You're right. But can you come to that name? Very good. Can you come to that name? I'll give you 10 more seconds.
Sir, guarded valve. I don't know, sir. I am not able to recall.
Okay. So it's actually a watchman device, which is a parachute-shaped device used for left atrial appendage closure in atrial fibrillation. So you get 5 points for that. Okay, you identified the device. You said the use correctly, but you could not say the name. So it's 5 points. So that ends this round as well. Okay. All right. So scorers, can you help me with the scores now?
Yes, sir. So we have completed 9 rounds. And the scores are participant number 1, Samitra, 98.75 marks. And participant number 2, Akash, 80 points. Participant number 3, Aryan, 52.5 points. Participant number 4, Vicky, 72.5. Participant number 5, Devang, 46.25. Participant number 6, Radha, 55 points, sir.
So without wasting time, let me just one second. So let us go to Dr. Anirban for the penultimate round of this quiz. And Anirban, can you take over for the penultimate round of the quiz?
Yes, sir. Yes, I'll make it short and quick.
Yeah. So we'll go for 10 questions like that.
Okay, sir, we'll go for 10 questions because buzzer bit cannot take more than 30 seconds. But
okay, fine. So we can quickly go through the next round. Okay.
Okay, sure. So is the thing.
Sir, do we have to join for the buzzer now?
Yes, you have to join for the buzzer.
Can you just give me some
slideshow? Slideshow. Yes, now it's right. Now it's right.
Yes, sir. Amol, are you there with the buzzer?
Yes, I'm waiting for everyone to join.
Is it the same code?
Yeah, it's
Or
the
is
same
it-
code.
Okay. Then you can join. Everybody can join with their names.
So is it the last round or?
No, the rapid fire will be there. So it will take more 15 minutes at most.
Okay. Sir, could you tell the marks distribution of rapid fire and this?
Yes, I'll say everything. Don't worry. You all of you please join the round first. The buzzer platform which has been provided, please join with the code. Amol is waiting, I think. And please make sure your net connection is proper. Amol, is everybody there?
Yes, everybody has joined.
Everybody has joined. Can everybody just buzz and let Amol
Okay,
know?
wait, no, one participant disconnected just now.
Which is that participant?
It's Radha Agarwal. She's joined back now. I think everyone's here.
Please ensure a good net connection at least for this round. Should I move forward for the instructions? Everybody is there, right?
Everybody is on the buzzer.
Okay. So what I'll be doing is I'll be showing you the question and say buzz, and after that only please say. I won't read out the question. I'll change the slide and say buzz. So there won't be any discrepancy of time before I'm reading and someone is buzzing and Amol is being vigilant. So I'm avoiding that slag. So I'll show you the instructions. This will be a buzzer round on this app. So the quizmaster will read out the question. So I'll cut short this. The team buzzing, this also does not hold valid. So the thing which you have to note is it will fetch 2 questions have 20 marks at the end. Those are some difficult connects, and 10 marks for each buzzer. If you give answer, if you opt to buzz, then you have to answer. Even if you don't answer, you will get a -5. And there are some questions which have part markings. Please be careful with that. There are certain instructions also. Please see the slide properly and then buzz. Don't buzz just because you have to answer first, and you will get only 5 seconds to answer. You won't get 10 seconds after you buzz, 10-20 seconds after you buzz. You cannot mumble after you buzz. Okay, so just as Amol tells me which is the team, you have to start answering and you will get 5 seconds for the answer, and you will have -10 for the 20 marks question. So you will get 5 seconds, not more than that, and my decision is final. So shall we start? Everybody is ready. Please give me a...
Yes, sir. Is there any pass like
ready.
If the first person is not...
There is no pass. There is no pass. You have to answer, and if you get it wrong, I'll move on to the next question. There is no passing.
So how many questions?
20 questions.
20?
Yeah. It will take 30 seconds. If you cannot answer within 5 seconds, I'll move on to the next question. Amol, are you ready? Amol, am I audible?
Yes, I'm ready.
You're ready, right? All 6 participants are there, right?
Yes.
Okay, please get ready. I'm showing you the first question and buzz.
Vicky has a buzz.
Chemopod for cancer therapy.
Right. You get 10 points for this. Excellent. Vicky gets 10 points here. Great. That is how you should answer. You should answer as soon as Amol starts. Amol tells the name of the person who buzzed first. You should. Amol, reset the buzzer. Please be careful in resetting the buzzer. Reset?
Yeah.
Yes. So I'll move on to the next question. This is the answer. I'll move on to the next question. Participants, be ready and see the question. Buzz.
Vicky is first again.
Vicky. So Vicky, tell.
RTMS, that's magnetic stimulation. RTMS.
RTMS and most recognized indication part marking is there here.
Is it
Please
for schizo?
No, you get negative here. You get 5 marks for the RTMS part and minus 2.5 for the this thing. So you get a total of 2.5 points. The most recognized indication is resistant unipolar depression. So that's why I said read the indication properly. And it's bipolar depression. So anyway, you get 2.5. It was a brilliant spotter, which you got it correct. Reset the buzzer.
It's reset.
All teams ready? So I'll move on to the next question. Please see the question properly and buzz.
Akash has buzzed.
So Akash, please answer.
Sir, is this VATS?
Can you say the full form?
Video assisted thoracoscopic surgery.
No. It's definitely video assisted robotic surgery, but the thing points towards thyroid here. That's why I said.
MIVAT.
No, you cannot answer right now. Yeah. So anyway, it's a bilateral axillo breast approach for robotic thyroidectomy. MIVAT is a bit different actually. So because this is called BABA approach and it's very upcoming thing for robotic thyroidectomy. Right. So Akash gets -5 here. Scholars, please note. Buzzer reset, Amol?
Yes, buzzer is reset.
Okay, we'll move on to the next question. See the question properly. There might be part marking or there might not be. And buzz. There is part marking here. Buzz. Anyone who has buzzed?
Aryan has buzzed.
Aryan?
Sir, I didn't buzzed it. Automatically clicked on my phone.
Okay. We'll skip this. Let's skip this. Please be careful with the buzzer.
Sir, I also buzzed after that. Like, do I get to answer?
Amol, did he buzz after that?
I got his buzz like 1 second ago, just before he spoke.
Okay, Soumitra, can you just say?
Sir, that it is the specimen analyzer, hologic specimen analyzer.
What it has been approved for? You have identified the purpose properly.
Purpose, I don't know, sir.
You have said the purpose actually, but
okay.
It is actually approved, and that's why its generic name comes. So anyway, you are right. I'll give you 5 and -2.5. Okay, so you get 2.5 here. So this is a portable mammography machine. That is the generic thing for which, and the only indication for which it is approved right now. It is also being, it is also going to be used in certain other surgeries like thyroid also. It is for breast tissue analysis post PCS and MRM. So buzzer is reset.
Sir, it's showing you have been disconnected. So is it a problem from my side or?
I have been disconnected, but my slides are showing, right?
Yes. No. It says on phone that you have been disconnected. Like the buzzer website, it's saying. So is it that my net is slow or something like that?
It's working, I guess.
Okay.
Okay.
We'll move on to the next question. So we'll move on to the next question. Reset the buzzer and all the teams see the question properly and buzz. There is no part marking.
Akash is buzzed.
Akash, quick. Akash, are you there? 5 seconds.
Okay, sir. I'm muted. It's deep brain stimulation. We put it in globus pallidus interna.
No. You won't get any part marks here. It was very specific. So you get -5 here. It is in subthalamic nucleus. in Parkinson's. For dystonia, it is in globus pallidus internus. So you get -5 here. So next question, reset the buzzer. All participants.
Reset.
All participants, please be careful in seeing the slide and buzz. Identify and brief indication, part marking is there. Anyone buzzed?
No buzzes.
Okay, I'll move on with the answers right now. So this is, as you can see, balloon is being occluded, and
I have buzzed.
So you have buzzed after I told if any team has buzzed. Yes. So this is a balloon occlusion of the aorta, and it is called REBOA, resuscitatory endovascular balloon occlusion of aorta. It is used in unstable pelvic fractures to stabilize before definitive surgery or external fixation, which usually takes time, but this is a very short 10 to 20 minutes procedure. So we move on to the 7th question. Because it's past 12, I'll go ahead with 10 questions. I'll share you with the slides because I've prepared good questions after that also, and 10 questions and the 220 markers. So I'll cut short the round here. And the 7th question, please reset the buzzer.
Buzzer is reset.
And teams, be careful. And your question goes now. Buzz. This is a connect. And you have to answer.
Akash is buzzed.
Akash, please.
Yeah, that's showing sideroblastic anemia. This is showing swan neck deformity. We are seeing koilonychia. So that's an electrophoresis showing an A1 peak. So not able to do the final diagnosis.
Okay, so
Anemia, Sidro, I'll give the hemochromatosis.
No. You should not have attempted. So you get -2.5 for this thing, and other images are actually, I'll give you 3.75 for this and -2.5 for the final connect. Okay. So the final connect is actually, these are all causes of microcytic hypochromic anemia. This is actually beta thal trait. It's quite easy. And it is rheumatoid hand, which is, I will accept swan neck deformity for that, and it is ring sideroblasts, and in sideroblasts it was koidonychia in iron deficiency. So we'll move on to the 8th question, buzz. What does it show? Aryan, please say what is it?
Sir, is it showing the Mosquirix vaccine?
Right, you're right. You get 10 points here. Aryan get 10 points here. Score note. I'll move on to the 9th question. Buzzer to be reset.
It's reset.
Hello.
Yes.
Total 10 questions, no? For the 2 more remaining.
Yes. 10 questions only and 220 markers.
Next 20 markers. Next 2 what?
No, not next 2. 10 questions and then 220 markers. Okay. So shall we move on?
Yes.
So participants, be ready with the buzzer and see the question properly and buzz. Identify the histopathology and disease. It's quite tricky. Anyone who is buzzing? 5-10 seconds are over.
Sir, I've buzzed.
Soumitra has.
Tell the answer.
Sir, Hirano bodies hai, and the diagnosis is ALS.
No. You're wrong. You are the part marking. I'll give it to you 5 and -2.5. So you get 2.5. You get 2.5. It's in Alzheimer's. You got it. You got that spot diagnosis correct, but the disease actually skips out of mind. It's such less time. So it's Alzheimer's. So we'll move on. Please reset the buzzer to the 10th question. Buzzer
Yes,
reset?
it's ready.
Okay, so please we'll move on with the final question, final 10-mark question in this round. Participants see the slide properly and buzz.
Vicky has buzzed.
Vicky, what's the answer?
ABP, accelerated partial breast irradiation.
Right, that's a fantastic, that's the beauty of buzzer round. Some questions will just strike you in a flashlight of a second. Right, so 10 questions are over. I'll now move on quickly through the slides so you can see the questions which were there. This was the histopathological image and this was the diagnosis. This was a previous INI set question. And this is it was used for influenza. Right. This is another tricky one. But if you get it, no, it's not mitochondrial. You would think it's mitochondrial.
X-linked dominant.
Yeah, right. It's X-linked dominant. So this is another flashlight of a diagnosis.
It's on pencil or what?
No, it's endovascular ultrasound. And this is a characteristic ECG phenomenon named sign. Is actually Katz-Wachtel phenomenon seen in BSD. And participants, please be ready now. I'll give you the 20 marker now. I'll give you the 20 marker. Please read the slide and then buzz. Okay. Buzzer is reset. Amol?
Yes.
Amol? Amol?
Yes, it's reset.
Okay. So participants, please be ready. The question, 20 markers, is now. Please
Sir,
read.
just a second. Okay, it was showing me disconnected. Now it's connected. Sorry.
Okay. So participants see the question properly and buzz. This is again a connect and there will be part marking. But be careful. This is a 20 marker. See the question. Maybe take 10 seconds and then buzz. And you have to tell the diagnosis and everything to me. Anyone
Can we just try the
buzzed?
connect? Can we just try the connect?
Amol, anyone has buzzed?
No one has buzzed.
Sir, can we just try the connect without the diagnosis?
No. You cannot. You have to buzz, and because no one has buzzed, I'll not go ahead.
No. Can we buzz and just say one of the connects? Is that fine?
I told you to buzz.
So, like, do we get partial marks? Not sure for that.
Yes, I told you. There will be partial markings. There will be part markings.
Akash is buzzed.
Akash, try.
Sir, bottom right image is showing mucocutaneous candidiasis.
Right.
That's all I want to try now.
Because you tried and you have to try the whole thing and connect also.
Sir, I asked you if I would get partial marks or not.
You will get partial marks, but the negative marks will also be valid, na? You won't just get the plus thing. That was the buzz around instruction.
Sir, I asked you before that, sir.
No, I told you partial markings will be there. Positive and negative both applied. That was the thing at the beginning of the round. I read out the instructions.
We also got negative for partial.
Okay, so I'll attempt the fine. Okay, the mucocutaneous candidiasis, that is showing B12 hyperpigmentation seen in B12 deficiency anemia. That is showing pallor, and CT scan is showing basal ganglia hyperintensities. Anti-cancer drug. If I don't attempt, like, do you have to attempt to get anything, or is it fine?
It's better you attempt.
Okay, I'll anyways be getting the negative, right?
Right.
Okay, so group will be alkylating agents.
Okay. So for the group, you get -5. For the connect, you get -2.5. And for the connect, I'll give you 3.75 here because 3 images are right. And this one is actually ectodermal dysplasia. This is hyperpigmentation, which can be seen in pernicious and Addison's. Either one I would have accepted. This is basal ganglia calcification, as you rightly pointed out, which is seen in hypoparathyroidism, and the final connect is APESED, autoimmune polyendocrine syndrome type 1. So a similar syndrome is produced by the immune checkpoint inhibitors, which is the new group of drugs which is being asked left and right in INICET. So Akash gets 3.75, -2.5, and -5. Coders, please note that. So this is the final question, which will carry, and groups, please buzz. Part marking will be there. If you are sure, buzz, there will be part markings and half negative. Anyone buzzed, Amol?
No one has buzzed.
Participants? No one?
Aryan has buzzed just now.
Aryan? What's your answer?
Hello, sir.
Yes,
Fourth image is Culex mosquito.
Right.
And the first image is, I guess, showing the encephalitis stage, and the third image are the symptoms of the encephalitis and stage also. Like it may be in like fever, numbness in the limbs, gait difficulties. And the second image is showing, maybe it is Japanese encephalitis, I guess. And second image showing
Japanese encephalitis. That's where people will
cycle
go
of
wrong.
the pig and amplifying host. A bird is the maintenance host, and then a bird is a maintenance host, and pig.
Is there a pig? Is there a pig here?
Sorry. Birds are the maintenance host for the Culex mosquito in Japanese encephalitis.
No.
Birds.
Give you part markings. Don't worry. You answered the first and second image, so you get you get 5 points here. But you get the final connect wrong, so you get -5, and you get -2.5 for not answering these two images, second and third image, properly. So it is actually a very close differential to JE, and that's the beauty of this question. This is West Nile fever virus encephalitis. It presents similar to JE. It is carried by the same vector, Culex. In India, it's Culex vishnui, and here pigs are not involved. Horse and humans are the dead end host. And the reservoir host only is the birds, and the amplifying host both. And this is a diagnosis. This is a CDC thing for symbol for acute flaccid paralysis, right? So Aryan gets a total of, I think, -5 here, if I'm right.
So -2.5, I guess.
-2.5. Okay, -2.5. So I'll end my round here. So I'll get my rapid fire PPT now. So the scholar, can you please tell me the marks and rank wise who all are there, because I'll be conducting the rapid fire rank wise from the last person, from the 6th person who is there.
Sir, scores from the 6th person. Standing 6th is Devang Agarwal with 46.25 points. Standing 5th, Radha with 55 points. Standing 4th is Aryan with 60 points. Standing 3rd is Akash with 67.5 points. Standing 2nd is Vicky with 95 points. And standing 1st is Soumitra with 103.75 points.
Hello, excuse me. It's 105 for me. It's not 95. Can you check once? Because I answered two answers in the rapid fire, and 2.5 I got.
Yes, it was 72.5.
There was one
It was
medical.
70.
It's correct. I think there was one.
95 not total. Okay.
So,
Hello. Excuse me.
hello. Is it clarified?
Yes, when round 9 was completed, his score was 72.5, and in
Okay.
round 10, he scored a total of 22.5. So it's 95.
Okay.
Yes,
Okay.
yes, it's
Fine.
solved.
Fine. Fine. So
Okay, sure.
Yeah, I think, we'll move on to the rapid fire round. I think since we are running short of time, we'll have to speeden it up. Okay,
Yes.
so we'll have a quick discussion. Without any discussion, we'll have a quick rapid fire. Okay.
Yes, sir. So Devang, you have the
Yes.
chance right now to maybe jump back to some more points
Yes, sir.
and jump your ranks. So these are the instructions. All the teams, please note, each team will have a set of 10 questions for the rapid fire round. The team can read the questions as their own ease without my interference. Each set will be given a maximum of 70 seconds. Please read out the question number before giving the answer. That's very important. Each correct answer will fetch you 5 and -2. So if you're not sure, don't answer. You won't get any negatives. And the quizmaster will tally the number of correct responses simultaneously and read out the correct response after the given time is over. Or maybe I'll just display the slides because of time crunch. And my decision will be final. And so we'll continue. Devang, are you ready?
Yes, sir.
Whoever is maintaining time, please maintain a time of 70 seconds. Are you guys ready?
Yes, sir.
Okay. Your time starts now. Devang.
Yes, sir.
70 seconds only.
So fifth one is no, 1 minute. So seventh is IgE.
Okay.
So ninth Meckel's cave is trigeminal law.
Okay.
Sir, 10 is 0.
Okay.
Sir, putty kidneys in TB.
What? Specify.
Okay, sir, I will leave it like, sir, TB, TB, renal or TB. Okay, sir, I will leave that.
Okay, I will accept. Then?
Osmic front murmur.
$70 seconds have passed.
Yes.
Okay, fine. I'll move on with the answers right now. So here Devang gets 3 questions right. The putty kidney one, the Meckel's cave one, and the ATP one. And he gets the 7th question wrong. So he'll get 15 plus -2. So it's 13 points. So here are the answers. You can get a quick look at it.
Yes, sir.
Okay. So who is the 5th person? Radha, are you there with us?
Yes, sir.
You will get a 70 seconds timers. Please note the time. I'll say, Radha, are you ready?
Yes, sir.
And your time starts now.
So first drug for hyperkalemia, insulin with dextrose. Question number 1.
Okay.
Question number 2, leukocytosis given a score of 1 in diagnosis of acute appendicitis.
Okay.
Involution is completed by 6 weeks post-delivery.
Okay.
So 7th is true.
Okay. Any other?
Glucocerebrosidase enzyme, galactocerebrosidase.
What do you want to answer? Please specify. You told two answers.
Sir, galactocerebrosidase.
Okay.
Sir, efferent is
70 seconds have passed.
Okay, fine. So Radha gets here only one question right and other question partially right. So she will get the first question -2, second question 1.5, third question -2, seventh question +2, and 10th question -2. So I think she gets 0.5, right, scorers?
Yes.
Okay, okay. So next person, whoever is there. Aryan,
Sir,
are you there?
Aryan. Yes, sir. Yes, sir.
Yes. Please be quick in answering. You
Okay,
have
sir.
got it. You have got it. You can become third from here. Just be a quick. Questions are not that hard. You can at least get 4 or 5. So your time starts now. I'll give you 2-3 seconds extra.
Sir, 8th question is Golgi body.
Okay.
So 10th is vitamin E. Hello, am I audible?
Yes, you're audible.
Sir, 9th is hypoglossal.
Okay.
So I would like to correct my 9th answer.
No, you cannot do that. You move on to the other.
Sir, it's glossopharyngeal.
Other questions.
Okay, sir.
One question I will let you.
Okay, sir.
Okay, started late.
Okay, sir.
Please be
first
quick.
is false. Sir, first is false.
Okay, bus. That's it. So you get 3 questions right and 2 wrong. If you would have changed the 9, you would have got it wrong. So that's why I did not let you do that. And anyway, you cannot change your answer. You have to be very specific. And if you save answer, stay with that.
Sir, what are the 2 wrong answers? Can you please tell?
You got 1 wrong. It is vitamin K toxicity, not E. E toxicity will just not cause hemolysis. It will cause a lot of other symptoms also.
Okay, sir.
So here are the answers. So I think he gets 13 points here. Am I right?
Yes.
Okay. So the fourth set will go to Akash, I think. Right, Akash?
Yes, sir.
Okay. So please be ready. Timers. His time starts now.
Dermis and subcutaneous tissue is grade 3.
Okay.
USG is the imaging modality IPHS.
Okay.
Okazaki fragments is the last 10th one.
Okay.
First one is acute interstitial nephritis.
Okay.
AIN.
Should read the question properly.
Okay.
Okay,
Sorry.
then.
Yeah.
$70 seconds have passed.
Okay. So Aryan gets, Akash gets 3 questions right. And the last question, he did not read it properly. It is atherosclerotic disease. So he gets 13 points. So here are the answers. So second person who is there, Vicky, are you ready?
Yes, I'm ready.
Have a cool head, but be quick. Your time starts now.
Ninth is fifth nerve, trigeminal nerve.
Okay. Specific?
Mandibular division of trigeminal nerve.
Okay. Go ahead.
The 10th is vitamin B6 pyridoxine and betaine is used. B6 and niacin B6, yes, B6 is used. And Swiss cheese appearance is adenocystic. Yes, and no, sorry.
Can you just
yes, adenocystic carcinoma of salivary gland. And PD for inhibitor is roflumilast. PD for roflumilast. Pyrogallus test. That antemortem postmortem embolism, pyrogallus test. And Garden classification is for neck of femur fracture. Winking owl sign is for metastasis in spine, hirsutism. That is Dillon procedure is rectal prolapse. Dillon procedure. And then that hirsutism is
70 seconds have passed.
True.
I'll just confirm what is your 5th answer and 6th answer.
Garden classification is femur fracture, neck of femur fracture.
Then the 6th one.
Pyrogallus, that one. Antemortem and postmortem, that embolic cloth, I guess, something forensic autopsy, not.
No, I cannot give you that. So you get the Delorme procedure correct, you get the hirsutism one correct, you get the winking owl sign correct. So 1, 2, 3, 4, you don't get the pyrogallus test correct, you get 7 correct, you get 8th one correct, you get 9th one correct also, and you get 10th question, half of it is correct. You told B6, but you did not tell the second vitamin. Betaine is not a vitamin. So you get
vitamin C or what? Sorry.
No, it's not that. So you get 2.5 and 2.5 and -1, 1.5 for the 10th question, and for the rest questions 1, 2, 3, 4, 5, 6, 7. You have got 7 correct. So 7 into 5, 35, and 1 negative -2. So you get 36.5 and minus 36.5 and -2, 34.5. Am I right, scorers?
Yes, sir. 34.5.
Okay. So Soumitra.
1 second. Just I'm calculating.
Okay,
yes, sir.
Sure.
Done. Okay.
So be cool-headed, be calm, and your time starts now. Sorry. Wait. Can you reset the thing?
Timer is reset.
Okay. Soumitra, your time starts
Yes, sir.
now.
Sir, fifth is Galeazzi's test. Sixth is Rayleigh phenomenon.
Okay.
Seventh is aprepitant.
Okay.
Eighth is 35 days.
Okay.
It was a pharyngeal cancer.
Pardon?
No, I haven't answered. I haven't answered any. Shiny corner sign is this fourth one.
Okay.
And MVAC regimen is the high risk choriocarcinoma.
Okay.
Which is left? Sir, which is left? Can you just tell me?
1, 2, 9, 10.
That is.
70 seconds have
10th
passed.
is dilated cardiomyopathy.
Okay, fine. You got third question is dash regimen for high risk. It's IMACO regimen, not MVAC. So, and also called backshot regimen. I'll give shiny corner sign to you. It's also called Romana sign. And 5 it's I told it's a provocative test. It's Barlow test, which is provocative. Galeazzi and Ottolani are not provocative. And 6th one, you got it correct. Rayleigh. 7th one also correct. 8th one is 42 days. SAGM is 42 days. Others will be 35. CPDA is 35. 10 type of cardiomyopathy, you got it correct, is dilated CMP. So you get 4 questions correct. So 20 points and 3 negative. So 14 points. Scorers?
Yes, sir. 14 points.
Okay. So that's I'll conclude my quiz with this, and scorers will now and Rahul sir maybe will say the final results of this quiz. Thank you all. And I had a buffer set of questions. I'll see whether I required it or not.
All right. So once again, fantastic round by Dr. Anirban. This is why, he's probably rank 1. It's because of his selection of questions. I really like that his distribution of questions. So if you look at the overall quiz today, we have had a very good coverage of the entire range of topics of an undergraduate should know. So first of all, by the time the scorers calculate the scores, how was the quiz overall? Soumitra, to begin with you.
Sir, I absolutely loved the quiz. Means itne sare rounds the, and the rounds were clinical. They had images, they had connect, they had rapid fire buzzer. Like literally, you could ask for everything that was there, and everything went so smooth.
A long quiz. I would always say that. See, this is a 3-stage quiz, and this is with the top brains of the country. And I think it requires these many rounds to segregate who is leading. So that is what that is why we had these many rounds. Now, Vicky, how was the quiz?
So the quiz was very awesome, sir. Starting from the first round, then the second round was very clinical round, which Dr. Anirban has conducted. And the final round, it was, I can't express also, like all the teachers from different subjects, they have included all the clinical questions along with the various integrated questions, the rapid fire. It's a full combo. So I very enjoyed it, sir. It's what
even when Anirban was conducting the round, it was like a nail-biting round for me. Even I was actually looking who's actually saying and who is not. So fantastic set of questions. So it was a holistic coverage. And Akash?
Sir, I enjoyed the quiz. Actually, I watched the quiz live last year where I think Anirban and Arman and Shagun and others were there. And that time I thought that probably one day I might be able to reach that level and I might be able to come to the finals of this quiz. And apart from that, I think the questions and like you said, 11 rounds, that made the quiz a bit fair. So even if some people, or even including me, got easier questions in some rounds, it got almost cancelled out by the end of the quiz. So it was more of knowledge rather than luck. So I would say a great.
Yeah. And Radha?
Yes, sir. It was an amazing experience. All the questions were so. Though I'm feeling bad for doing them so many wrong, but
No, that is okay. See, it's always Anirban would tell you because he has participated in multiple quizzes. Because every quiz is actually a learning experience. Okay, so suppose if you, because see, this contest is between the best brains in the country, and you having qualified to the finals itself is showing that you are having a very good potential. No doubt about this, and there is no need to feel bad. You have done exceedingly well. This is why you are in the finals as well. Okay, so I'm sure the next time we are conducting a quiz, you will be the topper as well. And Deva, how was the quiz?
So this might be one of the best quizzes I have given in a long time. So let's say we are in the third year, so we have not the proper grip on subjects like surgery, medicine, pedia, and even an obstetrics. But it just opened my horizon. Like there is so many stuff which I can learn, and like so many things which I can actually cooperate and do for it. So actually that gave me more idea. So like this quiz was actually very awesome on how much fast we can do the same thing. That actually tells like how much we can learn.
So it is very important to integrate these subjects as well, when you learn, because you have time in front of you. So always learn to integrate, even in certain rounds, if you could integrate between certain topics, you could actually come to the answer. And even in DocTutorials also, we have a separate section of videos, and we are adding more videos to that are integrated MCQ discussion videos. So where multiple faculties are coming together and discussing MCQs. So definitely it will be highly beneficial for all of you as well. And I should also say a special thanks to Alok, Shila, and Nadir of 66th batch of Calicut Medical College. Am I right? 66th batch, right? All three?
Yes, sir.
Yeah.
Yes,
So
sir.
for being with us, and also a special thanks to the College Union Government Medical College Calicut, including the chairman Justin Binney and Henna, the general secretary. And so much of support was there from the entire union part as well. So thanks a lot, everyone. And I'm sure that you are all waiting for seeing who are the rankers. Okay, so first of all, I think without any ado, we'll go for the winner. Let's go for the winner. So who's going to be the winner of this quiz? Nadir, who is the winner of this quiz? Rank 1.
We have completed 11 rounds, and the winner of the quiz is Vicky Datta with 129.5 points.
Okay, hearty congratulations, Vicky. Hearty congratulations. So you win, in fact, you win one of the best quizzes, and you win 25,000 rupees and access. But already Vicky is a student in the DocTutorials app. So anyway, so he will not require another subscription. He's already having a subscription. But Vicky, you're there. Vicky.
Yes, sir.
Yeah. So rank 1 in this quiz. Okay. And this is a position that Anirban had actually occupied last year. So you're supposed to get rank 1 in the next INICT, Vicky. Okay.
So we'll try my best.
Sir, I was second. Sir, I was second.
You were second. Okay, Anirban was second. So all right. So Vicky, you have got to top the competition up next. So Vicky, how do you feel?
Sir, I feel very awesome, sir. I didn't expect, sir. For me, sir, getting selected in the top finals, it was great, sir. I didn't expect I will win this quiz, sir.
Vicky, you have always been very active student. You remember the time I conducted some online live session also, Vicky, you were very active.
Yes, sir. Yes, sir. Need PG discussion session, sir. Yes, sir.
Need PG discussion. And even my Telegram group also, you are very active. So yes, happy to see that. Okay. So Soumitra, I think, equally deserving. Soumitra was leading in the last round, but again, very well-deserving candidate. It's just a matter of a couple of questions. That's it. Soumitra, you were super awesome today. Especially certain questions that you answered, really had some wonderful answering, Soumitra.
Thank you, sir.
Yeah. So Soumitra, you're an intern? You're an intern?
Yes, sir, intern.
Intern. Very good. Very good. Excellent. So rank 2 is Soumitra, right?
Rank 2 is Samitra with 117.75 points.
Okay, what is the total score of rank 1?
Total score of rank 1 is 129.5.
Okay, all right. So rank 3?
Rank 3 is Akash with 80.5 points.
Okay, Akash? Akash, where are you?
Yes, sir. Actually, I was downstairs to have a snack.
All right. You have a snack. Okay. So you can
Yes,
have
sir.
definitely have a snack and a big dinner also tonight because you're getting some cash prizes as well. So yeah. All right. Good.
Thank you,
And
sir.
so for me, everyone is a winner. As to begin with, all of our faculty said the same, because hearty congratulations to everyone who have participated in this awesome national event. And last, Anirban, what do you have got to say? Anirban, are you there? Okay.
Hello.
Yeah. Anirban, any last words from your side?
Yes, sir. So I'm like, this is a very like unique experience for me after like I had last quizzed in one of the quizzes in endocrine, I think, and I got second prize there. And I was very disheartened that this is going to be my last quiz in UG. It was actually 9 months ago. So I was very disheartened that maybe I would not be in quizzing, but as this opportunity came, I could go back to my UG days where I quizzed, and I also hosted one quizzing event as a quiz master. And so that after that mundane competitive exam and some highlighting, you get to organize a quiz and get back to UG days. So it's a unique experience. I also cannot explain in words. And seeing the winner change in last moments, that has happened so many times to me, and I feel so happy that like such a thing happened, that till the last round no one knows who is the winner, and you have to hold your nerves till the last moment. That is what quizzing is about. And sometimes that is what you will face in real life scenarios also. Some momentary decisions will make or break. So that was a fantastic quiz. It was quite a bit of long dragged quiz, maybe because of my rounds. I apologize for that, but I tried to put
absolutely. I think those rounds were actually the beauty of the quiz, because that actually gave the quiz a 360-degree perspective as well, bringing all subjects together. Wonderfully framed questions, Anirban. And I'm very happy that, I told Anirban, come Anirban, let's you also be a part of the team to conduct quiz. Initially, Anirban was thinking, sir, should I come? I said, you should come. So yeah, so I think, all went well, Anirban. And Anirban is definitely an avid learner, that I should definitely say, because even now, I'm proud to say that, he was one of our students. Even now, he is our student because, he's there in our NEET groups as well. Correct, Anirban? About the...
Yes, sir. Yes, sir.
So we have specific groups for all super specialties. And I think, Anirban, you must be enjoying the discussions in those groups as well, right?
Yes, sir. I'm quite clueless about most of the things, but I'm definitely enjoying the hang of the group discussions, and so many different points I'm learning. Like it's becoming a bit of foreign and random, but I am sure because I love the subject, I will get along in this SS part also. So it's a very wholesome experience that I'm having right now.
All right. So thanks, everyone. And Sheila Thomas, you can conclude from and also those participants who did not get the top 1, 2, 3, there is no need to worry at all. It's just a matter of a day. And I'm sure that, the next quiz, you all will be with us. And Sheila Thomas, from the College Union part, you can conclude.
Sir, Rahul sir and Aniban sir are really overwhelmed with this event. Sir, I'm also happy to be a part of this event, and heartiest congratulations to the winner in this game. And congratulations to all participants. You all have done a great job. Thank you for your cooperation, and thanking all the quiz masters for being with us. It's been a great honor to have you with us. Thank you.
And thanks to all the quiz masters, Raja Mahendran sir, Sandeep Sharma sir, Raji Dhawan sir, all are experts in their fields. And you all can stay connected with us faculties through the DocTutorials groups. And we have our Instagram pages as well. You can stay connected for academic content. And for any academic doubts, please feel free to stay in touch with us. So thanks you everyone once again from my side and the team of DocTutorials and also the College Union Calicut Medical College. Good night. Bye-bye. Thank you, everyone.
Thank you, sir. Good night.
Thank you so much, sir.
Good night, guys.